Yeah, so yes, everything seems to be running perfectly. Yeah, okay. All right. So, as we all know, we are in the time where everyone is very busy in their life. They are having a very hectic life. The management, I mean, the physical talking. Now, let's talk about deep aspects. Okay, and trust me, every part of this lecture today is going to be super fun and super interesting, as long as you are going to get involved and engaged. So usually the lectures are a little longer and high on time, but we'll try to take this one a little more concise, and let's try. But once I try to go in the depths, once the things start cascading into the depths, then sometimes yes, we need to take time to understand few concepts. Anyway, so now I'm talking about a thing where people have lost interaction. Now just look at us, look at the times where learning was a process where we physically went to a place, we sat down with our friends, and then a lecturer or a professor used to come, and then we used to learn, we used to engage in that physical interaction was there, and then things used to happen, and that's what we used to call learning. But now look at now, it's 9:30 Saturday night, and then we are starting learning at this point where we usually sleep. So the ultimate point being the physical interaction, the live interaction with people. In fact, live interaction with the family members or live interaction with anyone has dropped down significantly. It has taken over into a complete digital form, where without WhatsApp, without Instagram, without Facebook, it seems very tough right now. And then maybe some people are there in the house only, and yet with the family members they are talking on WhatsApp and rest of the things. So why I'm saying this, why I have even got this up in the first place, is this particular aspect, even if you deny, creates a sense of stress over a time, over a period of time, because ultimately there is no release for it. The physical talking, the physical interaction with the family members, with the friends, had you ultimately getting that out. So even food, for that matter of fact, it's ordering has become so easy, where you just open a phone, open the app, and the food is delivered in 5 to 10 minutes. And all these factors, basically why even we are talking here about all of this, is we are moving towards the westernized culture. We are adapting the westernized culture, and as indians we look up to the westernized culture. We don't value our systems. So all this has led to what? All this has led to the things, the issues, the problems, all those aspects which the westerners face. When we say westerners, uh, it may be a US or UK, or that's westward. That's what we meant by westerners, westward. So all the problems which even they are facing, exactly the things are what we are going to face. And let's be practical. Okay, let's be practical. It's said that US or UK or the west world is 10 years ahead of India currently. So whatever they are facing currently in terms of patients, or whatever the patients are facing currently, or whatever the people over there are facing currently, is something which is going to be very very similar, which the Indians are going to face. Now why am I saying this? Is because for every small thing, okay, there is a pill available. Okay, then be it for stress, be it for nutrition, be it for hydration, be it for regeneration, be it for anxiety, be it for appetite creation, be it for getting some mindful sleep. Every possible small thing which you can think of has a pill available westward, and this is actually a fact. This is actually a fact. And how readily they are available, like here we have DMarts, so it's actually available in some marts over there where there are shelves of these pills. Okay, so ultimately what the West world has become is a pill popping nation. Pill popping nation is, okay, now I'm feeling anxious and I'm having some anxiety, I'm having some stress, let me get some stress and anxiety relief pill. I'm not able to sleep right now, I'm having issues in just like maybe having a good sleep for 4-5 hours, okay, let me pop a pill. Next 5-10 years, this same situation is going to be faced by the Indians and the people of India, and all these exact same things of the pill popping nation is going to happen with India as well. That I'm very sure. By looking at the way the trends are, I'm very sure. So this was about the pills. Same thing if you convert it into therapies is exactly what we are going to talk about. You know, IV medicine or solutions or therapies for such small issues are something which are going to catch up. Okay, and eventually they will be a big, very big thing. Currently also it is catching up, and where people are aware about it and people know about it, people have started adapting it. Imagine in the next 5 to 10 years what's going to happen. So I'll just give you a context also on, so that this is a thought which you can build upon and read about it further on after this lecture, post this lecture, whenever it ends. That I cannot guarantee you when it ends. So the thought is, over in the US there are IV bars. They are actually called as IV bars. So someone is having a work life crisis, or someone is overworked, he'll go in the IV bar, get an IV done, and then go back to the work again. Or someone had plenty of drinks last night, so he'll go to now from that bar he'll go to the IV bar and get those things, and get back to work again. So the dependency on medicine is going to keep on increasing. The dependency on, very important word, the dependency on nutraceuticals, the dependency on supplements, okay, the dependency on these nutraceutical and supplements are going to have a tremendous upward movement, okay, in the coming years. And all you're going to see is just that. It has already started, where people, just remember 10 years back, do you even remember someone was consuming a gummy for hair or gummy for skin? 10 years before, do you even remember someone was consuming a tablet for skin whitening? No, you don't remember. But this is going to keep on happening, and that is what our topic for the day is therapies in the clinic also, and all about therapies in the clinic. But the ingredients what we are going to talk are going to be always present everywhere, which we will be dealing with, and eventually you will be finding them becoming more and more common over a period of time. Okay, so let's begin with the lecture for the day, that is Meso and IV therapies and new therapies in Meso, like Meso Electroporation and Meso radiofrequency. They're very easy, but our focus for today is going to be lots and lots of ingredients and lots of discussion and understanding on how these ingredients are ultimately working on the human body. Okay, so it's going to be a detailed one. Okay, so brace yourself. I get a lot of statements that the lectures are long, but we can't help it. You have to be prepared. We have to go in depth. Everything works. If the things started working superficially, then you did not need to have the lecture today. Okay, even to understand this lecture and even to work even the meso solutions to work, even they have to go in depth. So even we'll have to go in depth, and for that, of course, and someone has messaged, if it's too long, it's going to be too enjoyable too. So that's the way, that's the spirit should be. Okay, so topics for the day are mesotherapy, MNEP. That's a very new topic and very new concept in medical aesthetics. MNRF, this has been there since a long time. So how do we combine mesotherapy along with MNRF is what we are going to talk of. And all infusion therapies which are available and how they are branded. Okay, so why we had begun the lecture by talking about westward, okay, and everything in the West and how things are in the West. I've spent my precious years in US, and looking at the people over there, they are obsessed with luxury. Okay, they are actually obsessed with luxury, and they would go to any extent to flaunt their luxurious lifestyle or anything which they are doing which enhances their luxury. And out of that, IVs have become a very luxurious thing, which were a thing of only the weak person, or maybe even the person who's very weak, person who has fever, cough, cold, maybe even that is a person who was entitled okay, who was entitled to receive IV. But the concept of IVs have completely changed, where the IVs have become, intravenous therapies have become a thing of luxury, and the what of the IVs is going to be discussed today. Any which ways, so let's begin from the basics, let's begin from the scratch. So when we talk about mesotherapy, the first thing which we need to know is about mesoderm. Okay, it's not a unique term. You might have heard about this always, right from your medical school to right now, which you're hearing continuously and which you'll keep on hearing, is mesotherapy. So mesotherapy is to deal with the area, the location in which the therapy is being done. Okay, so mesotherapy means a therapy which is being done in the mesoderm. Okay, if I have to put it out that way. So if you look at these cells, these are the cells which make up most of the human organs and the system, basically. So whatever is ectoderm, okay, whatever is ectoderm would ultimately create your nervous system and the skin. Okay, that is the ectoderm, that is the external skin. Whatever is in mesoderm would create muscle, skeleton, kidneys, reproductive system, and whatever is in endoderm would create your endocrine, lungs, digestive tract and liver. Okay, so for now just understand that there are cells of mesoderm which will eventually form the mesoderm layer in the skin. Okay, so these cells which you saw here, the cells which you can see here, ultimately are going to transform and transgress to form various elements in the skin. So basically we know that the skin is comprised of the epidermal layer, which is superficial, which is the most external layer, which is the epithelial tissue, and it is derived from surface ectoderm, the one which we just saw. Okay, ectoderm, the surface ectoderm would end up eventually making the epidermis, or the most external part of the skin, that is the epidermal layer. Okay, now the dermis is a deeper layer comprised of dense, irregular, arranged connective tissues, okay, which is derived from mesoderm. Okay, very important part which you need to remember. So what we understood is the epidermal layer is getting originated from the ectoderm, and the dermal layer is originating from the mesoderm. So what do we conclude out of all of this is the mesoderm is basically the dermal layer. Okay, as you can clearly see in this layer also, whatever epidermis is formed is from the ectoderm, and whatever the dermal layer is formed is from the mesoderm. Okay, so mesoderm or mesoderm would eventually form the parts of the dermis. Okay, I'm going very slow and I'm going to go in very detailed here because it's a very important aspect, because this aspect will unfold the treatments which you will be doing in your clinic, and lots of insights on how you will be doing your treatments in the clinic. Okay, so again, ectoderm forms the epidermis and the mesoderm would form the dermal layer, and the dermal layer consists of the connective tissues and cells. Connective tissues and cells. So dermis has connective tissues and cells and formed from the mesoderm. Okay, this is what you need to understand. Okay, so let's look at this ectoderm. Okay, and mesoderm, as you can see, so ectoderm would eventually form what? Your epidermis, which consists of your stratum corneum and all the layers, lucidum, spinosum, basale, everything of that. And if you look at the mesoderm, which is present here, it forms the dermis. Okay, it forms the dermis, and dermis has what? Dermis has plenty of connective tissue and cells. Okay, this is what you need to understand. So when we talk about mesoderm, mesoderm basically forms the dermal layer. Okay, and then when we talk about mesotherapy, so that means it is the dermal therapy. That means whatever pharmaceutical medications, amino acids, vitamins and anything which you are going to use is going to be transfused into the mesoderm, which is nothing but your dermal layer. Okay, and at this point you will also remember something, that mesoderm is consisting, that is the dermal layer is consisting of connective tissues and the cells. Okay, so now once we start talking, you'll understand why we go in depth. Okay, so mesotherapy was first described by a French physician. His name was Michael Pisteur. Okay, and that was back in 1952. There's a very interesting video on YouTube which you should also check out, is vaccination via mesotherapy, and that vaccination was being done by vacuum and pressure therapy, where that vaccine was actually injected till the deep subcutaneous layer via pressure injection, and that video is actually available. Okay, so from a French physician, Michael Pisteur was the father of mesotherapy, and as we know, we always talk about history, because without history we are nowhere to be found. Okay, so Dr. Michael Pisteur actually formed the devices of mesotherapy, and there are plenty of books which he wrote in French, which are available in English as well to read. And if you want to understand more in depth about mesotherapy, you should definitely consider reading the digital versions of these, because I personally went through them and they are really in depth and in detail. Okay, so what did Michael Pisteur quote? He quoted that little, rarely and in the right places will give you all the possible results. So you don't need too much, you don't need a lot, but if you just have just the right amount in the right place, that is going to be sufficient. Okay, now guess what did he, what elements he might have started experimenting with. Okay, he experimented with a lot of allopathic medicine, but at the same time he also used a lot of homeopathic medicine to infuse them in the mesoderm. Since homeopathic itself is an injection-less therapy, I mean homeopathy promotes injection needle-less therapy, what they so called it as. So over there the need arises to have a device or subsequent way to transfuse some elements in the mesoderm. and he used plenty of homeopathic medicines for that purpose. Okay, so here you all should even be proud about it. Now whoever is the homeopath who has joined amongst with us, you all should be taking inspiration from this, and also the alternate therapy doctors who have joined, you all should be taking inspiration from this and keep this as your motivation factor, that even physicians are using homeopathic medicines to experiment for results in mesotherapy, and they were successful. In fact, a lot of complementary therapies in mesotherapy were being experimented with homeopathic medicines, right? So if it was so significant, I don't know why people nowadays are scared to use a few ingredients in mesotherapy, or just scared in general about it. Okay, it is used and it can be used for sure. Okay, so different sites of injections, that is different types of injection techniques, that it can be either epidermal, superficial dermis, or your deep dermis. Okay, so epidermic mesotherapy is basically just technique of injecting in the layers. Okay, and it is just very superficial, so just want to give a superficial regeneration in the epidermal layer. Then there is also a technique where you actually do it, or do thus multiple injectables in the epidermis. So that is called as epidermal meso. So when you start passing the epidermal layer, and when you reach the epidermal dermal junction, then it starts becoming dry and wet meso. So that is wet and dry mesotherapy, where it is much more deeper. If it goes beyond that and goes in the deep dermis, then it is called as mesoperfusion. Okay, and that mesoperfusion, that means reaching the deep dermis, okay, is called mesoperfusion. So that is intradermally between 2 to 13 mm. Okay, and this reaching the deep dermis via a technique which doesn't break or keeps the epidermal layer intact, okay, is called mesotherapy. So to conclude everything till now is, you had ectoderm, which makes your epidermis, and you had mesoderm, which makes your dermis, which consists of connective tissues and cells, which we are going to see. And anything to deal in the dermal layer would become your mesotherapy. Specifically, something which penetrates till the deep dermis would be eventually called mesotherapy. Okay. So we are talking more about the dermis because our entire focus and in your entire treatment layer is going to be in the dermal region, that is the mesoderm. Okay, so dermis, that is the layer after the epidermis. What it consists of, we've just studied it, that it consists of connective tissue. Okay, connective tissue. And what is connective tissue? Connective tissue is cells and extracellular matrix, EC matrix. Okay, so now we saw that mesoderm makes the dermis, and dermis is made up of connective tissue. You can see in the histopathological image which is here. Okay, you can see a lot of connective, all these dark pink stains which you can see are the connective tissues, and the connective tissues are made of cells and extracellular matrix. Okay, so just remember that now, that what I'll just repeat it, that mesoderm made your dermal layer was made up of connective tissues, and connective tissues is made up of cells and extracellular matrix. Okay, so the reticular layer is the dermal layer. Okay, so as you can see, the epithelium, papillary layer and reticular layer is the deep dermis, and the deep dermis is the area where we want the treatment to be happening. We want the entire mesotherapy to be working on this reticular layer, which consists of connective tissues, which are cells plus EC matrix. EC matrix is your extracellular matrix. Okay, so extracellular matrix plus what would the dermal layer have? It would have a lot of macrophages. What do the macrophages do? They take out the dead cells and then ultimately into the lymphatic system. Macrophages, mast cells and fibroblasts. Okay, so remember these two things also, because these are the things which are going to come into play when we are discussing all the ingredients in mesotherapy. All right, so again repeating, mesoderm, dermal layer consists of connective tissue consists of cells and extracellular matrix. So extracellular matrix plus cells, the cells can be macrophages, mast cells. Macrophages are something which will take away the dead cells into the lymphatic system and drain it out. Okay, so when we are talking about the extracellular matrix now, okay, don't lose the grip. Again, I'm repeating it. Mesoderm, dermis is made of connective tissue consists of extracellular matrix. And now what does the extracellular matrix consist of? Extracellular matrix consists of collagen, fibroblast, elastin and your hyaluronic acid. Okay, so that is what your reticular dermis is comprised of, that is what your extracellular matrix is, that is what your connective tissues are in the dermal layer. Okay, so when the person starts aging, the connective tissues start depleting. Ultimately what is depleting? Collagen, elastin, fibroblasts. Okay, all these cells are depleting. Okay, so let's know about the extracellular matrix more. So there are three major fiber forming proteins. Okay, it is collagen. As you can see, they are linear fibers. Okay, so these are collagen, these are linear fibers. Then there's elastin, linear fibers again. Okay, then there's fibronectin and there is GAG. Okay, and that is your hyaluronic acid. Okay, as you can see, that is much more complex than your linear structures, and hyaluronic acid becomes your one of the more important ones in that, and that also consists of proteoglycans. Okay, proteoglycans are much more complex structure, they are not linear at all. Okay, so ultimately what did we understand? Again, the extracellular matrix has collagen, elastin and your proteoglycans and also hyaluronic acid. Okay, so proteoglycans, as you can see, this is the further formation on how the proteoglycans is forming. Now why we need to know this is because when we start talking ingredients and we start talking science of those ingredients, that is a time when you will actually make all of these things will actually make sense at the end. Okay, so proteoglycans are covalently attached to many long linear chains. As we saw, many long linear chains are attached to those. Okay, so it gives the core structure stability also to the connective tissue. Okay, and this image also, if you all remember from the first year of your medical school days or medical college days, this is the way all these things are getting formed. This is the way your collagen, your elastin fibers, your proteoglycans are actually forming. Okay, so we spoke about GAGs, that is hyaluronic acid. Hyaluronic acid is one of the most important GAGs, that is glycosaminoglycans. Okay, remember this word because all the ingredients are based on this. Okay, the lecture is going to be super related, so if you miss out on something, you will end up missing out on or you will be end up having like what is happening. Okay, so again from the start, mesoderm, your dermal layer made up of your connective tissue was made up of extracellular matrix, and extracellular matrix consists of your collagen, elastin and proteoglycans, and your hyaluronic acid, that is GAG, that is glucosaminoglycans. Okay, now glucosaminoglycan, okay, is separately available as a supplement, which none of y'all might be knowing. Okay, or maybe a very few select people might be knowing. because when you talk about hyaluronic acid, we directly talk about hyaluronic acid. We never spoke about GAGs, but right now we are going to talk about it because this is a very common supplement in the West, that is glycosaminoglycans, that is GAG. Okay, its most important factor is to promote synthesis of collagen and elastin. Okay, so when collagen and elastin are formed, along with that it will also improve the formation of hyaluronic acid. So glucosamine sulfate is what is available as a supplement. Now remember this, along with that glucosamine sulfate, your chondroitin sulfate and hyaluronic acid, these will be primarily helpful in making your GAGs better, glycosaminoglycans structure much better in the dermal layer. Okay, so ultimately when you are working or when you are supplementing the person with glycosaminoglycans, which would be made up of glucosamine sulfate, chondroitin sulfate and hyaluronic acid, what would it do? It would give anti-aging and moisturizing. It would help in weight loss and also arthritis. Okay, so now we are coming to the ingredients slowly. Okay, it's better that you don't get confused. Okay, so we saw the extracellular matrix consists of collagen, elastin, your proteoglycans. Okay, and proteoglycans along with hyaluronic acid. Now to increase or make this more stable or make the extracellular more stable, you require to give supplements which will increase the GAGs, that is glycosaminoglycans, that might increase the glycosaminoglycans. And what are these ingredients? Now coming to that part. Okay, so very important part. So whenever we are talking practical points, I'll say the word practical points. Okay, so the practical point is glucosamine sulfate is one, chondroitin sulfate is one, and hyaluronic acid is one. Now these three supplements, if you are giving as a supplement, it will help in improving collagen, elastin, hyaluronic acid and GAGs, and also the proteoglycan. Okay, everything related to that. And you see how important it is. When these connective structures are given some importance, you will definitely have much better results in your procedures as well. Okay, so now we are coming to the principles of the meso. Now we are going into the crux. We understood the dermal layer, we understood the formations of the dermal layer, we understood what is there in the meso layer, mesoderm, we understood why it is important to work on those, and we actually saw the role of collagen, elastin, proteoglycans and GAGs, that is hyaluronic acid is one of the GAGs. So these four components, if you work on in medical aesthetics, you will always find results. Okay, so principles of mesotherapy are dependent on what materials you are using. So now let me give you a clear-cut idea. So if you are dealing with skin, okay, if you are dealing with skin, then the material should improve collagen, elastin, proteoglycans, GAGs, hyaluronic acid. That means when you're improving all of this, then your results are going to be super good. Injection sites, so where you're going to do is going to be very important. Injection depth, on how deep the injection should be, which needle to use and which machine to use. So if you know this, you will have the mesotherapy solved. So as I spoke about skin, if I talk about scalp and hair, then I know the material should be something which will increase the blood supply in that region, will repair the stem cells in that region, okay, will also improve the collagen, elastin, fibrinogen in that area, and new blood supply would be there in that, that is neovasculature would be there in that area. So that would become your ideal mesotherapy for your scalp. Okay, then injection site would of course be scalp, injection depth would be mid dermis, needle size would be around that 2 to 3 mm, that would be sufficient in the mesotherapy, and if you're not doing it, at least it should reach the mid dermis. Okay, so according to the site, according to the issue, according to the cause, your principles of meso change. Okay, your materials would change, your injection site would change, depth would change, and ultimately you would have a result. So these principles are what you need to focus on. Okay, so materials in meso would ultimately be working in the mesoderm, that is your dermal layer, and in that you will have two core ingredients, that is one will be your principal material and other will be your complementary material. Principal will be actually working on the site, and complementary, that means it will help the principal material have more results. Okay, so now let's look into it. Okay, so ingredients, what will be the principal materials? So as we said, as if we look at the principles of meso, the first thing is we choose the right materials. So we are going to have a good intense discussion on the right materials. Okay, so in principal materials, the ingredients, we are going to discuss with the scalp first. Okay, so in principal ingredients, it would be ingredients that have been used orally, topically or injectably for the each indication. Okay, the ingredients with high grade of evidence in treatments. Okay, and ingredients which are safe basically. So let me see in the chat, let me ask you all a question. If I have to treat a scalp, if I have to treat a scalp condition, what do you feel, what do you would recommend, what do you know of, which you are giving orally, injectable? Let me know. Someone has said, Dr. Jagriti has said biotin, someone has said B12 and trace elements, someone else is saying biotin, Redensil. Okay, very good, Redensil. What else? What are other famous? What are few FDA approved materials? Let me know few FDA approved materials. Procapil, what is a FDA approved material? Acetylcysteine, very good. One new, very good. Minoxidil, very good. Minoxidil, yes, very good. What else do you feel? Any other oral supplement? Finasteride, excellent. Sky Aesthetic is giving some fire answers. Finasteride. Okay, do you all know the brother of finasteride? Someone is saying pumpkin seed extract. Shubhangi has said dutasteride. Excellent, you all are killing it, actually killing it. Dutasteride, yeah. Sky Aesthetic is again said dutasteride, very good. Any other therapy which you know of in hair? Therapy, where what we would do in the case of hair fall, hair loss? Calcium pantothenate, Dr. Priyan has said calcium pantothenate. Some stem cell, very good, superb. I mean, the people, everyone who's attending today y'all have made my day. Therapy, PRP, GFC, multivitamin, mesotherapy, too good, lovely, very lovely. Someone has said QR678, so QR678 would be the brand name, but you need to know the core ingredient. So if someone has said QR678, so what is there in QR678? PRP, GFC, excellent, lovely. I mean, if you all were there in front of me and this was a actual offline lecture, I would have really applauded. Threads, you told me the name of that, I need the component. Vitamins, okay, very good, amazing, every one of you all, amazing. Okay, so let's go ahead. Okay, someone has said hair cocktail, I don't need the brand, I need the components. Okay, all right, okay, all right. So that was the primary, that means core. Yes, like these are working only, we know that these are working. Okay, whatever you all have said are actually working. Okay, so now we are looking at complementary materials. Complementary materials are the ones which will help aid the primary materials, which will help in improving the results of the primary ingredients and enhance the results basically in meso. So now we are going to take, and my personal favorite in medical aesthetics is trichology. people who have attended live with me actual offline classes also would know trichology is the first thing which I will always implement to perfect, and then we go on to the skin and rest of the things. Okay, so complementary materials, can anyone think of any complementary? All the materials which you said right now are primary. Any materials which you feel would be complementary, like having low effect but maybe enhance the effect of the primary materials? B complex. Okay, so everyone knows the core. Glutathione, very good, very good, very good. Your brains are working perfectly fine and at a full RPM at Saturday night, which I am very happy. Ascorbic acid, omega-3, 6, vitamin C, ZPTO. Okay, all right. Y'all are all going to let me just break this news out to you. Whoever is answering, whoever is typing in the chat, y'all are all going to be masters in meso. Trust me, mesotherapy. All will be known as masters in mesotherapy post this lecture, I'm very sure. Okay, so now let's get into it. Okay, so as we said, the materials in mesotherapy which have to go in the dermal layer, they will have a primary ingredient and a complementary ingredient. So we talk about making peptides, we talk about making cocktails, so we make the meso solutions. Okay, we will make the meso solutions. Forget being dependent on the big companies who are making meso solutions and giving it to you. From this lecture onwards, it should be, I know what meso solutions I need to use for my patients, because I know the primary ingredients and I know the complementary elements. All I need to do is just make them infuse and let them go in the dermal layer so that it works. So if I know the 2 to 3 principal primary ingredients and 1 to 2 complementary ingredients, I will be able to give them results. Okay, that is the core principle. Okay, so in the scalp, what are we looking at with mesotherapy? Hair loss and androgenetic alopecia. Okay, in the skin, what are we looking at? Facial regeneration, facial pigmentation, and in weight loss, what we are looking at? Body sculpting. So all of this which we are going to look at. Okay, so let's now talk about hair meso. All of y'all have wonderfully answered, and I am very happy when the group knows the answer. I am the most happiest person. Okay, so now let's, before going to the meso ingredients, let's go in the depth, because without going in the depth, you're not leaving anything. Okay, so now don't read what's in the inside in the black, what's written in the black. Let's try to understand why even the issues are happening in the hair. Okay, so primarily what is happening is poor, so aging would happen. Okay, aging would happen. Aging would act where? Aging would act in the mesoderm. In the mesoderm, what is going to get reduced? Your connective tissues are going to get reduced. Once the connective tissues are reduced, what is going to happen? Poor blood flow is going to happen. Because of the poor blood flow, what is going to happen? Nutritional deficiencies are going to happen. Nutritional deficiencies are going to happen. There's going to be a short anagen phase. That is a short hair growth phase or short hair retention phase. And there's going to be miniaturization, and ultimately it is going to cause androgenetic alopecia, AGA. Then whether it's male or female, it's the same. Okay, that's going to cause androgenetic alopecia. Okay, and if it is hormonal, then what would happen? Then the testosterone would eventually be converted into DHT, that is dihydrotestosterone, with the help of 5-alpha reductase, ultimately producing the damage or damaging the hair protein which makes the hair. Okay, and ultimately what would it do? Short anagen phase, and then ultimately loss of hair follicle, miniaturization, and androgenetic alopecia. So this is how the scalp is working. This is the only way the scalp is working in. Okay, so what all can you see? Poor blood flow. So if it is poor blood flow, so we know what are the ingredients: minoxidil, Okay, that is going to be the key ingredient. If it's nutritional deficiency, then what will be the ingredients to give? Vitamin B12, biotin, vitamin C, E, amino acids. If it is hormonal, then we know that testosterone is getting converted into DHT via 5-alpha reductase. So what we give? 5-alpha reductase blocker or inhibitor. That is what? Finasteride, dutasteride. Natural ingredients which you all answered: saw, palmetto, pumpkin seed extract, everything of that. So this will inhibit or increase the blood supply, decrease the nutrition, decrease the hormonal imbalance, lengthen the anagen phase, and then ultimately stop the loss of hair follicles and stop androgenetic alopecia progression. Okay, this is the plain trichology science, basic hair science, trichology science, which you just need to remember. Okay. So again, what would be the indication of hair mesotherapy? Excessive hair loss, seborrhea of the scalp associated with the sebaceous gland, and a very important aspect I am going to discuss after this slide: dandruff, dry scalp, increased hair fragility, that means the hair breakage is very common, split hair, volume loss, and androgenetic alopecia. So these are going to be your indications. So almost all indications, if I could just sum it up, almost all indications in the scalp. Okay, now we are coming to the ingredients. So these can be the principal ingredients. Okay, so it can be a B12 or it can be a biotin, and it can be pantothenic acid, that is vitamin B5. They can be your principal ingredients because they are time tested, researched, and shown to have benefits to lengthen the anagen phase, to reduce hair fall and regrow the hair. Okay, so it's been time tested and verified. Okay, what else do you see is in the complementary, that is pyridoxine, zinc. Zinc is very, very important and essential, and we always try to supplement zinc in the skin issues like in acne, but in hair also it has a very, very big role. Okay, now maybe this ingredient you all might have not heard of, but in the skin you all definitely might have heard of it: azelaic acid. Okay, azelaic acid, which is considered to be a very good ingredient for acne and to reduce the sebaceous gland activity, and also very good ingredient for post hyperpigmentary disorders. Okay, so that is a very good complementary therapy in hair. Along with that, multivitamins. So all possible multivitamins which you can note, which are there in your MVI. I saw someone that day asking what is Mayor's cocktail. Mayor's cocktail is nothing but your multivitamin injections. Okay, so it's a cocktail of multivitamins. It's been named or termed as Mayor's cocktail. And MTE is an antioxidant. Okay, so it can be any antioxidant, whichever antioxidant you want. Okay, so there are tons of antioxidants which are available. And please note, these are all topicals which we are talking about. Okay, these are not powdered form, these are not tablet form, these are not in any other consumable form. These are in application form, topical form, serum form, liquid form, injectable form. Okay, so now, as I told you, we were going to talk about a very important aspect, and this is that important aspect which we are going to talk about. So here, if you remember in this image, testosterone was getting converted into DHT with the help of 5-alpha reductase, which was doing damage to the production of the hair protein and ultimately reducing the anagen phase. Okay, so now let's look at that in a much more detailed manner. So progesterone, androtestosterone also forms ultimately your testosterone. The testosterone which is separately produced in the human body also. So now in this image, let me break down this image. Okay, let's go slow here and let's break down this image because this is a very, very important image. Okay, so what you can see here clearly is testosterone is of course the male hormone. Okay, but progesterone is not. Progesterone, estrogen are female hormones. But now look at the beauty of it, that progesterone can also be converted into androestradiol, and androestradiol can be further converted into testosterone. Okay, and then testosterone can further get in combination with 5-alpha reductase, okay, which makes up the 5-alpha DHT, and 5-alpha DHT ultimately works on inhibiting the hair production by damaging the hair protein. Okay, so this is our culprit. 5-alpha DHT is our culprit. Okay, so this is what we need to get rid of. But as you can clearly see, it's not only the males but also the females who can have increased number of production of progesterone, and ultimately have more testosterone, and ultimately have 5-alpha DHT. Okay, so why I was saying this is important. Now in the people, now in the people who are obese, who are fat, who have high cholesterol levels, who have high triglyceride levels, okay, just a question in for, since today the energy in the group is very high, out of the HDL and the LDL, which is the bad cholesterol? Out of the HDL and LDL, which is the bad cholesterol? In the chat, give me the answer. Out of the HDL and LDL, which is the bad cholesterol? Oh, mixed answer. First time it's happening that, okay, but there's a more concentration towards a specific answer. Very good, very good. Few of them initially got it wrong. Few of them initially have got it wrong, but I can see maximum of them are getting it right. So that is LDL cholesterol. So not necessary. Very good. HDL. Dr. Sahaj has made it so easy that he's said that HDL has H, so H is healthy, and LDL is L, that is lower, that is bad, so that is bad cholesterol. So very good. And for the first few ones who got it wrong, so hopefully this is an eye opener for you. Okay, so if at all someone is consuming more oil which is high in LDL, okay, and this is particularly your coconut oil, your soya bean oil, your oils which are made from the ground oils, that is groundnut oil, okay, all these ultimately would increase the LDL levels. Okay, palm oil, very good, palm oil, yes, definitely. So now what is going to happen on such people? Okay, this is the depth which we are talking about. This is what we need to understand. So sometimes we just blame it on the hormones. Okay, as in almost all my lectures I've been talking about how you have to break down the underlying cause. You have to understand what underlying reason is happening, and this lectures hopefully make you all more aware about it. So when we blame about hormonal imbalances and hormonal causes, but you can see none in the blood reports. Okay, maybe you will see no high levels of free testosterone, okay, or maybe you see that periods are regular, okay, thyroid is regular, rest of the hormone profiles are regular, still the person is having tremendous hair fall. Okay, so that issue is linked and lies here, okay, which is very much not looked into. Okay, when would you look into? When you know that this might be a cause. So any obese person who's coming to your clinic, okay, you know his LDL levels are high, or maybe you do a blood investigation, you know his LDL levels are high, he's going to have cholesterol levels which are going to be high in nature, which is ultimately going to increase his DHEA levels. Okay, and his DHEA levels are ultimately going to increase his androstenedione levels. Okay, and that level is going to ultimately increase the testosterone level, and that ultimately is going to increase the 5-alpha DHT levels. So not necessary just the testosterone is to be blamed directly. It can be an indirect surge in the testosterone via the cholesterol pathway. Okay, so even this metabolism via the cholesterol pathway is ignored by most of the doctors practicing in medical aesthetics. So that is why the superficial epidermal knowledge is something which you throw out of the window and you start going in the depths. So this is going to be a very important aspect when you're doing consulting, when you're taking history, when you're doing history taking. Basically this factors, if you're not finding any issue in the hormonal aspects, actual hormonal aspects, there are alternate pathways also which are ultimately causing to increase the level of testosterone. Okay, so you have to remember this. So even in the blood investigation, DHEA can become a very important aspect if the person is obese or you find that his dietary habits are not up to the mark. Okay, and that ultimately also can increase the testosterone levels, ultimately causing increase in the DHT levels. So you might supplement the person. Okay, very important line which I am saying. You might supplement the person with 5-alpha reductase inhibitor, but if you don't take out the cause which is increasing the testosterone, ultimately the person is going to suffer. Okay, so underlying cause has to be removed along with the 5-alpha reductase inhibitor. 5-alpha reductase inhibitor would be just working temporarily to reduce the DHT. Okay, so you have to actually break down to how the testosterone is metabolized, and these are only the two good pathways via which it is getting metabolized. And now I have narrowed it down for you. I have made it very easy for you. So it can be either actually via the testosterone pathway or the progesterone pathway, which are actual hormonal pathways, so which you can take in the history taking and also analyze it clinically. But if it is not, if the clinical significance or clinical history is not showing any evidence of the direct pathway increasing the DHT, then it might be the cholesterol pathway which is affecting and increasing the testosterone level. So you have to narrow it down, and I have narrowed it down to 2 specific levels, so you can give much better results in patients. Okay, so now we are coming to the aspects of the hormonal imbalance. Okay, now that's where your azelaic acid also plays an important role. Okay, so azelaic acid is said to have 5-alpha reductase inhibitory properties. Okay, it might be news for you, but yes, it is true. So zinc and azelaic acid both are said to have 5-alpha reductase inhibitory properties, and of course along with that you all did mention minoxidil, finasteride, dutasteride. Let me give you few more. Saw palmetto, okay, pumpkin seed extract, quercetin. Okay, so what do you find here? What do you need to do here? You need to find 5-alpha reductase inhibitors which are available, and that you can use in the principal and complementary, combine it and use it in the meso solutions, and then you'll get results which will be 5-alpha reductase inhibitors. Okay, so minoxidil, as we know, we always talk about minoxidil's effect on vasodilation, that is it just vasodilates and gives more supplements, but also it helps to lengthen the anagen. That means the anagen phase is also increased in by using minoxidil. So that is why it is also used in the minoxidil. Minoxidil is also used as a meso solutions. So not only in the home care, but you can also use it in the clinic specifically. Also for the percentage of finasteride and dutasteride, 0.01%, 0.01%, minoxidil can be 2% or 5%. Okay. Now difference between dutasteride and finasteride, everyone thinks that dutasteride and finasteride are the same, but any which ways I would like to ask to the chat that or the group who's attending right now, that which one out of these do you feel is FDA approved? Is it dutasteride or finasteride, or which is more safer? finasteride. Oh, okay. Someone has said Duta also. Someone is saying dutasteride. Few of them saying dutasteride. Most of them saying finasteride. Some of them still saying dutasteride. Some of them saying finasteride. Okay. Some of them saying finasteride side mein likha hai. Okay, fine. So you read it, the first line itself. That's why the answers have come. Okay, okay, all right. Okay. So side mein likha is a different thing, but what you know also, it should be there. Okay. So for the people who said dutasteride, so yes, dutasteride is not FDA approved. It is a off-label treatment which is used in the scalp or for the hair regrowth. Okay, in the same, let me just ask you something what is maybe not written. So what is the if dutasteride is a off-label treatment, it's written as off-label. So if dutasteride is off-label, what is the primary role? I mean, what is the primary indication of dutasteride? Dutasteride is said to be off-label and finasteride is said to be FDA approved. Two answers are there. I'm waiting for few more. Very good, very good. Excellent, excellent. You all have been doing your reading well. Three of you all, 3 answers. And that is the right answers. That is prostate hyperplasia or benign prostate enlargement in the prostate. Okay, whenever the testosterone levels are higher, then that is a time when you ultimately would eventually would have the grown size of the prostate, and the prostate needs to be contained and controlled by controlling the testosterone, the DHT levels, and to control that you need a 5-alpha reductase inhibitor, and that is where the dutasteride comes into play. Okay, so that is why it is off-label, because the primary indication is prostate. Okay, similarly, so if that is the case, so do you think that giving finasteride would also work on the prostate? Yes or no? What do you feel? Okay, forget finasteride. If we give saw palmetto or pumpkin seed extract, would that work on the prostate? Would that work on the prostate? No, someone, most of you all are saying no. No. Okay. So as I said, the prostate is also because of the same reason, because of the increased testosterone and then ultimately the increased DHT and ultimately causing enlarged prostate. Okay, so if you are inhibiting the 5-alpha reductase, you will also get results in your prostate. Okay, so these are the things which you need to understand and correlate. So whatever is 5-alpha reductase inhibitor, you can give in the prostate also. So whatever you are giving in the scalp to inhibit the 5-alpha reductase would be your ultimate treatment for 5-alpha reductase. Okay, so let's look at the difference quickly. So dutasteride, it's an off-label treatment because you're primarily using it in benign prostate hyperplasia. Okay, whereas finasteride is a FDA approved treatment for androgenetic alopecia. Okay, so now let me tell you something. That means finasteride is much more safe than dutasteride in terms of inhibiting 5-alpha reductase without hampering any other hormones. Okay, FDA approval clearly mentions that. Okay, so dutasteride, now comes the more important aspect. Okay, so dutasteride blocks both types of 5-alpha reductase enzyme. There are 2 types of 5-alpha reductase enzymes and both of them are being blocked, whereas finasteride only blocks type 2 of the 5-alpha reductase enzyme. Okay, so coming more on that, I'll tell you more about it when I complete this difference. So dutasteride leads to 99% of reduction in DHT level. That means it is much more efficient and effective. Okay, whereas finasteride reduction happens by 70%. Okay, so dutasteride is more potent than finasteride in treating male pattern baldness. Okay, and there are side effects that are related to sexual dysfunction. Okay, and in finasteride, of course, because we just mentioned the percentage is 70%, and of course the side effects are equivalent to dutasteride in terms of sexual dysfunction. Okay, now it can be used in combination to topical minoxidil to increase the efficacy, and can be used in combination, of course, with minoxidil. Finasteride also can be used. It is available in 5 mg of the tablets, and this is also available in the 5 mg of the tablets. Okay, so what you all answered earlier was perfectly fine, that even the type 2 of reduction of 5-alpha reductase needs to be there for a proper reduction in prostate. Of course, type 1 is required, but type 2 would ensure better treatment in prostates. Okay, so that is why it is off label. There will be more sexual dysfunction in dutasteride. Okay, and by sexual dysfunction, it can be erectile dysfunction also in the males. Okay, ultimately you are hampering the levels of the free testosterone by inhibiting 5-alpha reductase and ultimately working on the hormonal level. So yes, some sexual dysfunction can be there. So what is the ultimate concluding point is that if at all someone is planning or for conceiving, or is planning for or if is doing a family planning, then is a point where you say, okay, let's just avoid the oral finasteride or dutasteride. Okay, topical in one place will still be okay, but oral, I'm talking about oral. Okay, and even though coming to our topic of our mesotherapy, both of them would be better. Dutasteride would be more potent, but you have to make your logical choices according to the patient. So maybe a male patient with severe loss wants quick results, very fast results, and is okay, and I mean is a family person already, you can take that chance of using dutasteride more in such patients. Whereas a person who is younger, who is still not married, or maybe planning to marry, or maybe is planning for a family, planning eventually a child or something else, then over there you would prefer finasteride, but then again oral dosage you would completely maybe neglect or avoid. So these logical senses is something which you need to build, and that is why you are even attending these lectures, to make sane choices so your patients can also have the benefits. Okay, someone was asking you, can minoxidil also cause? The minoxidil is a potent vasodilator only. Minoxidil won't hamper or cause any erectile dysfunction or sexual dysfunction, but rather it would just give the benefits of vasodilation topically. Okay, if someone is taking minoxidil orally, which is also available, then some side effects related to the hypertension can happen, but that's second. Okay, so if anyone, so you have to actually see whether the issue is hormonal or issue is related to the imbalance, or what is the issue. So if it is telogen effluent, then you will give multivitamin, biotin, dexanol, or the antioxidant of your choice. And if it is androgenetic alopecia, that is hormonal, then what do we give? Minoxidil, dutasteride, biotin, dexanol. Along with that, zinc and azelaic acid, as everything mentioned below minoxidil is 5-alpha reductase inhibitor. Okay, and here as we just saw the pathway also, how blood flow and rest of the things can be hampered, nutritional deficiency can hamper the hair. So these would be a very good ingredient to add in the telogen effluent. PRP, as you all rightly said, of course PRP has lots of growth factors. So when you segregate, you get activated plasma, so you can always use that. Out of those, you can see PDF, PDGF gives cell growth, new generation, fibroblast growth factor give collagen, tissue repair. So all these ultimately work on the stem cells. Okay, so PRP also can be given in meso, but injectable is preferred. But someone doesn't want the injectable, you can give PRP. Okay, so who is this? Guess, please. Who is this guy? Who is this guy whose image we are looking at? All the boys, all the doctors, all the guys. I know he's a cricketer. You can clearly see the jersey, but who is he? Shamim. Irfan Pathan. Oh God. He's not Irfan Pathan. Okay. Okay, alright. Sami. Interesting answers, and few of them have got it right. Okay, he's in the news for the right reasons. Okay. So one of the, I'll not name the area, the clinic name, but one of the clinic, this was his hair condition. This is a image of, yes, of course he's a Indian cricketer, and this was his photo from during, of course, playing the cricket. I mean during playing cricket. That's why he's wearing the jersey. So this is what his hair condition was, and one of the hair transplant centers agreed to do his hair transplant free of cost, but the cricketer has to promote his hair transplant results on Instagram and, you know, promote their clinic. So that is what happened. So he's currently in the news, and he's currently almost everywhere in the news. So the person who said Irfan Pathan needs clearly to see more news. He's not Irfan Pathan, he's Mohammad Sami, and he was there in the news for some violence and abuse against his wife as well. So that's a different topic altogether. But since we just discussed all the meso solutions here, we've discussed all the ingredients of meso solution, and say Mohammad Sami somehow walks into your clinic, Mohammad Sami comes into your clinic, and Mohammad Sami in this condition, as you can see his scalp condition currently, as you can see, I'll just tell you where all the loss is. The loss is in the frontal, okay, temporal, frontal, temporal, mid parietal and vertex, and there's a very good amount of loss. So I need two things from you all. I need the grade of this hair loss. I need the grade of this hair loss, and also one primary ingredient which you will use. One primary ingredient. Grade of the hair loss and one primary ingredient. One primary. And do you think? First, let's get this. Someone is saying 3. 3 is wrong. Grade 5. In mesotherapy, not home care or anything, in mesotherapy, if the Mohammad Sami walks in your clinic and he says, I don't want injections, I'm a cricket player, I don't want any injections to go along, I just need some regrowth, so just do some mesotherapy. Someone saying Kenacort. Okay, grade 5. Okay, very good. Everyone else also needs to be a little more active. GFC, minoxidil. Otherwise, if you're not active, you'll end up sleeping. Okay, then that is what you don't want. PRP, PRF. Few fancy answers from few doctors. PRF, Kenacort are few fancy answers. Okay. Anyway, it's between grade 4 and 5. Okay, so it's between that. And also, if such a person is walking into your clinic, the first consulting would be that you have a permanent loss of hair follicles, and you are a case of androgenetic alopecia where most of your hair follicles are lost. It will be very hard to revive those hair follicles. So what we can ultimately do is just focus on improving the hair follicles near to your hair which are present. Now this is one thing which you all should know. Okay, even application and even treatment would work best in the areas near to the hair. Okay, where near to the hair growth. I mean, wherever the hair is, you can see the hair is there in the frontal and mid parietal. So all your treatment has to be based in this area where the hair is. If I have to give you a percentage, it will be only 20 to 30% improvement in the hair condition. by doing mesotherapy, because the patient is not going to even do PRP injectable therapy, just the mesotherapy. Okay, and it's a severe form of loss. Okay, so now we are looking at where all we can do. So as I told you, the white areas are the ones which will be the preferred area of the treatment, where the preferred area of the treatment, that means maximum therapy would be in the line and length of where the hair follicles are present. And then as you can see here also, wherever the hair follicles are present, towards the hairline the treatment is being done. Okay, wherever the hairline is, towards that the treatment is being done, but primary focus would be there wherever the hair follicles are present. Similarly is a case where you do similar treatment in vitiligo also. Wherever the pigment is present is the area where you ask the person to apply the creams or the serums of vitiligo. So because of that, the melanin production will happen, and the melanin will keep on sliding towards the internal areas. So even here the hair follicle regeneration would be happening much more faster towards the hairline, and then ultimately some betterment, that is 10, 20, 30% of betterment will happen in that area. Okay, so that is about it. Here if I have to give a preferred therapy, then it would be minoxidil dutasteride, since already he has a kid and he's divorced from his wife, so maybe right now he's not in the favor of having kids. So it is maybe at some point of time, I know I can take the chance of giving dutasteride for some time to give some results in this patient. And then also PRP GFC as a meso would be excellent, minoxidil can be excellent, azelaic acid as a complementary therapy will be excellent in this case. Okay, so this is how you will choose the injection site and the treatments to be used in mesotherapy. Okay, so now let's look at skin therapies, or the skin principal ingredients. And the skin principal ingredients are hyaluronic acids, amino acids, vitamin C, DMA, which we are going to talk about, organic silicum, fibronectin, vegetal proteins, which are your collagen and your elastin. Okay, plenty of things to talk about in skin. Okay, so this was principal ingredients in the skin regeneration. Let's look at what are complementary: vitamin A, glycolic acid, taurine, hexadien, MV, and antioxidants. Okay, so this we are going to see how the mechanism of action is. So now hyaluronic acid is one of your GAGs, okay, glucosaminoglycans, which helps in maintain hydration and elasticity of skin. Amino acids helps to improve skin tone, firmness and elasticity. Can someone name few amino acids which we can use on the skin? Some amino acids which we can use on the skin. Acetylcysteine. Come on, only one answer so far. I need few amino acids. What amino acids do you all know of? Glycine, leucine, yes. Go ahead. Let it coming. Let it keep coming. Arginine, L-acetylcysteine. Very good. Leucine, isoleucine, valine. All of these are your amino acids. Very good. Okay, so what will they do? They'll help improve skin tone, firmness, elasticity. And then vitamin C, which is the antioxidant that helps promotes synthesis of collagen. Okay, so it will not only help as an antioxidant but also help in production of collagen. Now DMEA, we're coming to a new topic. Okay, whenever there is a new topic, you have to shake yourself up so that it stays retained here. Okay, so DMEA, dimethyl aminoethanol. Okay, dimethyl aminoethanol. Okay, it's used in the skincare. Okay, and it's been widely used, but it's not popular in India because it's not known. That's the only reason why DMEA is not being used. But from now you know what DMEA is, dimethyl aminoethanol. Sometimes what I feel, sometimes I don't know, it's my personal opinion, the ingredients whose names are complicated are somehow they don't find a popular route, at least in India. Okay, the names which are very common, like vitamin C, then it would be picked up very quickly, or vitamin E, yeah, okay, let's get that done. But DMEA, people are getting scared. Okay, but DMEA has super fantastic results. Even the pharma companies, because there is no demand somehow, then the other pharma companies also don't come up with such things. But DMEA is said to have very great results and very fast results. Okay, so CoQ10, that is coenzyme Q10, is popular, glucanolactone and cyclopentasiloxone. Now these are the names. It looks like we are talking, we are there in some scientific movie, sci-fi movie, talking about some futuristic ingredients, but these are very readily available ingredients, they are very commonly available ingredients which are giving fantastic results. Okay, so what are the new ingredients which you are looking at? What are the new ingredients which you will be knowing? Okay, dimethyl aminoethanol. Okay, dimethyl aminoethanol, okay, is one. Cyclopentasiloxone is another, and glucanolactone hopefully you all might be knowing, and coenzyme Q10. So these are the ingredients which have fantastic results on the skin, on the collagen, and in the dermal layer. So what we are not using currently is DMEA, but from now, hopefully from this lecture, we will use it, because now we know what DMEA is. Okay, so how are we using DMEA? So DMEA, again, dimethyl aminoethanol. Okay, so how are we using DMEA? So we have plenty serums which have DMEA. So DMEA or coenzyme Q10, okay, you can have a combination of these and have used with retinol, that is vitamin A derivatives, to give great results in the skin. Okay, so how does it function? How the DMAs function? It's acting long also, and it acts in the neuromuscular union as a precursor to acetylcholine. Okay, so acetylcholine is where have you heard acetylcholine? Let me know quickly, where have you heard acetylcholine? Neuro, but which medical aesthetic procedure? Which medical aesthetic procedure? Botox, yes, perfect, Botox. You've heard it in Botox. So where will DMEA work on? Ultimately fine line wrinkles. Okay, all we knew that what is working on fine line wrinkles is collagen, or maybe some snake venom with valgarine. Okay, and we never used the basic DMEA. Okay, so which will work on the acetylcholine levels and work on the muscle contraction and relaxation. So DMA is going to work on that. Okay, so not only in medical aesthetics, but you have this conversation with a neurosurgeon and you ask him, are you giving DMEA to your patients who are having Alzheimer's or having any other issues related to the brain and issues related to that? He will give you a yes nod, and that is it. Okay, so it is not only working there, it's working on the muscle level also, working on the dermal level also, working on the acetylcholine. So fine line wrinkles are something which you can see reduction in. Okay, so now next new ingredient, we are talking all new stuff here. Okay, and when we have such lectures are beautiful for one reason. This entire lecture is about mesotherapy, where we are not using even a single needle. We are just completely basing it on the ingredients and the science behind the ingredients. Okay, so now we are talking about organic silicum, and organic silicum is going to maintain the extracellular matrix. Okay, one which we studied in the initiation of the lecture. The extracellular matrix, which consists of your fibrinogen, collagen, your glucosaminoglycans, which is your hyaluronic acid, and your proteoglycans. Okay, so it is going to help maintain the ECM, hydration, extracellular matrix hydration, tone and elasticity of the skin. So when we spoke about hydration and elasticity of the skin, as far as I know, because I've been interacting with all of you doctors, so I know the most common answer always comes is hyaluronic acid, ceramides, that's it. But now we've added 2 more ingredients to it, that is DM, A, organic silicum, okay, and similarly fibronectin and vegetal proteins, that is elastin and collagen. Now these we knew, but organic silicum is also very good in maintaining hydration. Okay, along with that, our most favorite, retinol, vitamin A, glycolic acid for exfoliation and cell regeneration. Taurine. Now taurine is an antioxidant, and taurine you might have heard in Red Bull. Okay, Red Bull has taurine in it, so it is one of a potent antioxidant. And Red Bull, one more common core ingredient of the Red Bull is caffeine. So caffeine helps you stay awake, and taurine works as an antioxidant. So taurine is again a very critical ingredient in the Red Bull. So what does taurine does? What does taurine do? Again, taurine is something underutilized in the skin. Okay, taurine helps in collagenesis and increases hydroproline dermal concentration. Now let's make all of that together. That is, it also helps in building the amino acid, helps in increasing the amino acids, so proline levels in the dermal concentration. So taurine, again a very underutilized ingredient which we can use in the skin. So again, multivitamin and choice of your antioxidants, which activates the biochemical reaction. So when multivitamin infusions are given, when antioxidants are given, it activates the biochemical reactions. And XADN, which is a very long chemical name, it consists of procaine, thiamine, riboflavin, niacin, pantothenic acid, pyridoxine. Okay, so whenever you are infusing multivitamins, that is Mayer's cocktail, so what is ultimately happening is it is activating biochemical reactions in the area, in the site of injections. Okay, so if you want to give regeneration, okay, so regeneration, these are the few brand names which contains the ingredients. Hyalif contains hyaluronic acid, Siloc consists of your silicum. So for the people who are asking where do you find and what are the brand names, Siloc contains your silicum. Your Purascorbal contains your ascorbic acid, but ascorbic acid is readily available. Zandenal consists your ZADN, which is components of your multivitamins which are present. Okay, so and taurinox consists of your taurine. Okay, pure retinol consists of your vitamin A. Okay, so these are few brand names which are available, which have these ingredients which you can use in mesotherapy or as a electroporation in skin, or mesotherapy for transfusing these elements in the dermal layer. Ultimately we've seen how they can improve the levels. So again, just renewing it, fibronectin, elastin, collagen, Silorg, that is your silicum, DMEA, which we just saw, vitamin A, hyaluronic acid, Silorg, silicum. Okay, all of these which we can use in facial skin regeneration. So a lot of people, lot of doctors keep on asking, apart from the glycolic acid, apart from the hyaluronic acid, apart from niacinamide, what is there in the skin, apart from the collagen, what is there in the skin. So these all ingredients are there in the skin which we never utilized, but you all should utilize it. Okay, specifically the DMEA, dimethyl amino ethanol, is something which you need to read and study about to give some much better interesting results. Okay, so now we can see the beautiful actress who has started aging, and of course if anyone is starting aging, they require anti-aging treatments and fine lines and wrinkles. So in okay, so now someone is saying this is a different actress. Now that doesn't work. This is a universally known actress, and someone not recognizing her is impossible. Okay, so here we know that her fine lines and wrinkles have started showing, and now imagine she's come to your clinic and she demands that I need a non-injectable mesotherapy. Okay, so hyaluronic acid, DM, AE, your silicum, these will be your key ingredients. So then we've chosen the materials. Now we need to know the sites of injections. So the sites of injections will be under eye, the cheeks, the nasolabial fold, marionette lines, and just above the eyebrows. Okay, and wherever the fine lines and wrinkles are there also you can choose. So the depth in the forehead and the under eye will be changing according to the depth of the skin. Okay, so now we are looking at the depigmenting ingredients in meso. Glutathione, kojic acid, azelaic acid comes again from the scalp, vitamin C and tretinoin. Okay, tretinoin helps in the cell turnover, so that is how it is working. Let me just give you a brief on how all the ingredients are working. Glutathione will ultimately help in production of more pheomelanin. It will inhibit production of some of the MSH on long term. Okay, now glutathione, there is a lot of controversy. Let me just break it down for you. Let me break it down in a very simple way. Okay, now if someone has a Fitzpatrick skin type of 1, 2 and 3, okay, let me make it much simpler. Let me make the entire glutathione debate much simpler. If someone has a Fitzpatrick skin type 1, 2, 3, then they'll have results in 3 to 6 months. Let's make it very simple. If someone has a Fitzpatrick skin type 4 and 5, they'll have maybe a results in 6 to 1 year. Anything beyond that, there won't be any results. Okay, simple, straightforward. I'll end the debate over there. There won't be any results. There will be improvement in the texture, there will be improvement in the consistency, there will be improvement in darker pigmentations which have happened, but the skin lightening acts only up till a simple Fitzpatrick classification. Okay, so even injecting truckloads of glutathione ultimately won't cause permanent lightening of the skin. Okay, so this is after I've underwent a clinical trial research paper which did a study on 100 people about how glutathione is working on multiple skin types. Okay, so ultimately to produce pheomelanin, the cells, the melanin producing cells should also have the capacity to produce pheomelanin. In the darker skinned individuals, the cells are accustomed to create much darker eumelanin. So their production of pheomelanin from the cells are only going to be very minimal. So what do you expect when the primary functioning of glutathione is production of more pheomelanin? So if the cells are only not made to produce pheomelanin, I mean in the darker skin individual, the cells are devoid. They don't know how to produce. Let me just make it simpler. They don't know how to produce pheomelanin, and how do you expect glutathione to work that? It's very simple. So over there you have to work more on liver kidney detoxification, texture improvement, keeping skin maintained, keeping skin healthy, antioxidant effect on the skin, anti-aging effect. All these benefits the person will get. Okay, kojic acid, azelaic acid, vitamin C and tretinoin. Okay, so again, so someone is wanting depigmentation, then you can give kojic acid, azelaic acid, tretinoin, vitamin C with hyaluronic or silicum. Okay, glutathione, okay, your potent serum or application, injectable form also, vitamin C, kojic acid, glycolic acid. So in the depigmenting way, how do we use it? Wherever the pigmentation is, you will choose the site of pigmentation and do mesotherapy in that area. Okay, someone has melasma or is whatever underlying cause, can be hormonal, UV radiation, improper use of products, it can be anything of it, and then wherever the site of pigmentation is, there you will infuse that till the dermal level. Okay, now we are coming to the fat loss. Okay, so fat loss can be reduction in localized fats, cellulite and stretch marks. Okay, give me few solutions of fat loss which you know. Quick in the chat. PPC, phosphatidylcholine, anything else than PPC? Very good. L-carnitine. So 2 answers so far, PPC and L-carnitine. What else do you all know? What else? PPC and L-carnitine. What else? GG. Come on, expecting some more answers. Garcinia gambosia. Will Garcinia gambosia cause fat loss in mesotherapy? Dr. Apeksha saying deoxycholine. Excellent. Lovely answer. Someone said Garcinia gambosia. Will Garcinia gambosia cause fat loss in mesotherapy? We are talking mesotherapy. Let me see some answers. Come on, think. Garcinia gambosia is oral, but will it cause fat loss in meso solution? That is what I am asking. No, it is appetite suppressor, appetite loss. Yes, very good. So logical thinking is required. Garcinia gambosia, even if you do mesotherapy in the localized area, is not going to cause fat loss, because that is not the way it is intended to work. This lecture is all about that, understanding the science about how scientifically each ingredient is working. Okay, and till now we've not given any injection. Okay, we've seen hair, androgenetic alopecia, telogen effluvium. We've seen skin regeneration, where fine line wrinkles also was targeted with M.A.C. We've seen pigmentation, where pigmentation was covered with so many ingredients, and we've not used a single site of injection. All we've used is mesotherapy. We've just used mesotherapy so far, no injections till now. And still I can proudly say, with even the mesotherapy and using those scientific ingredients which you are talking about, we can deliver great results. Similarly, now we are in the weight loss. You all did try and very good. That was also highly appreciated. So let's look into the weight loss, where you would dissolve the lipid layer or work on the subcutaneous layer. Okay, so now let me ask a very interesting question. So now till now what we are looking at is mesoderm forms the dermis, and so entire therapy of mesotherapy is completely based on the mesoderm or the dermal layer. Okay, but subcutaneous layer is much more deeper than the mesoderm. It's below the deep dermis. So do you feel that doing mesotherapy in for weight loss will give effective results? Mesotherapy in the weight loss patients. Let's see you using your brains. You have to use your brains. Dr. Pooja says no. Annie says no. Princess says no. Dr. Sheetal says maybe meso solutions can percolate. Dr. Madhuri says less effective than subcutaneous. Someone is saying yes, no. Okay. Let's break it down. Okay. I'll give you a experiment. That experiment was, pig fat was taken, pig fat was extracted. Okay, pig fat was extracted, and pig fat was injected with lipolytic solutions. And when the pig fat was directly injected, that means extracted and injected with the lipolytic solutions, then what happened was the subcutaneous fat started disintegrating, and within 4 to 5 hours all the pig fat became viscous. Like when someone was touching the pig fat earlier, it was very squishy, it wasn't breaking down. Post the injection, the fat just melted in the hand, like it became viscous. Okay, and in the next experiment, what was done, all the layers of the skin were kept intact till the subcut layer, and then just an subcutaneous injection was given with the insulin syringe, and then after 4 to 5 hours it was the subcutaneous fat was taken for testing, and it showed almost negligible difference in any consistency or anything. Okay, so now what do you feel, like if at all the PPC goes till the dermal layer, do you feel it will help in breaking down the subcutaneous or weight loss or inch loss? Rather, inch loss would be a proper terminology. So now what do you feel post the experiment results? Do you feel yes, it will help in weight loss? Yes. Interesting. Okay, most of y'all are saying yes. Okay, some same results are not seen when the epidermal, dermal and subcutaneous layers were intact and it was injected just in the dermal zone. The subcutaneous layer saw very minimal change, and when it was injected directly, the subcutaneous fat turned into viscous, like when viscous consistency, that when the fat was taken it almost went. So now let's look at that, let's break down the answer. Okay, so for the meso to work, your primary ingredients will have to be injected deep. Okay, none of the meso in the weight loss therapy, that is the primary ingredients, if taken or just used in the dermal layer, they will have minimal or wastage of the component. Okay, so the answer is no. Okay, if you just use mesotherapy with phosphatidylcholine or deoxycholine, okay, these are your lipolytic agents. Okay, phosphatidylcholine or deoxycholine, these are your lipolytic agents. So if these are used in the mesoderm or in the dermal layer with mesotherapy, very negligible effect will be seen. So your primary role will be to inject it actually in the subcutaneous layer, which is at that depth. So which area you are doing will be depending on that. If it is in the abdomen, if it is in the hand, it's the lipoma. Depending on that, the depth will be decided where it actually reaches the subcutaneous layer. Okay, and mesotherapy will come to that when the mesotherapy will work. Okay, now new ingredients. Now we'll be looking new ingredients in the scalp, new ingredients in the skin regeneration, new ingredients in the weight loss also have to be there. Okay, so hyaluronidase. Okay, hyaluronidase, where have you heard hyaluronidase? Let me know. Hyaluronidase, where have you heard? Hyaluronidase, where have you heard? Hyaluronidase. Botox, someone is saying Botox. Okay, and most of them have got it right. Filler. So someone is saying to dilute Botox. Whoever is saying to dilute Botox, you need to come and listen to our lectures and come in and get engrossed in all of the lectures which we are discussing. So yes, it is fillers. Fillers are your hyaluronic acid, okay, and it is not the hyaluronidase, it is hyalase, which is derived from hyaluronidase. Okay, let's break it down. Let me make it simple for y'all. Let's make it simple. Fillers are your hyaluronic acid. Okay, now hyaluronic acid is injected either in the dermal layer or wherever. Now if at all there is an adverse reaction or unwanted reaction which is there, to dissolve that, or necrosis which is happening if you are injected in the artery, to dissolve that hyaluronic acid, hyalase is used, which is hyaluronidase. Okay, and that dissolves the hyaluronic acid. Okay, it dissolves the hyaluronic acid, it breaks down, it disintegrates the hyaluronic acid molecules and gives you results. Okay, so it's used to dissolve the fillers. Okay, so if it can dissolve hyaluronic acid in the dermal layer, when the hyaluronidase is injected in the subcutaneous layer, it also helps in dissolving and disintegrating the subcutaneous layer. The molecules which hold the subcutaneous layer together are also broken down with the hyaluronidase. Okay, so apart from the phosphatidylcholine and deoxycholine, hyaluronidase is also something which is used for injectable lipolysis. Okay, apart from that, artichoke is a grocery or is a vegetable which you can find, and there are actives in artichoke which will help in lipolysis. They are lipolytic basically. Okay, so now when you want to go intermediate, that means you don't want to give it in the subcutaneous, you want to be little above the subcutaneous layer, then let's see what is useful, which ultimately will give some results. L-carnitine, aminophylline, yohimbine and artichoke. So these are the key ingredients which you, if you want to go a little bit above the subcutaneous layer. So if you want to give something above the subcutaneous layer, that is, maybe you will use ultrasound lipo which you get with the weight loss. Okay, which will penetrate some ingredients. So you can use L-carnitine, aminophylline, yohimbine, artichoke combination, which will help to penetrate these things till 6 mm. Okay, which is intermediate, and get some results. Okay, so instead of using the ultrasound gel, you can actually use a solution of L-carnitine, aminophylline, yohimbine, artichoke and give much more better results. And if you're doing mesotherapy now, if you just want to do mesotherapy, you can do it at the depth of 2 to 4 mm, which will have your L-carnitine, aminophylline and pentophylline. Now this won't work on the subcutaneous fat, but it will work on cellulite. So you won't get actual inch loss, but you will get reduction in the cellulite. So definitely meso solutions work for fat reduction, work in cellulite reduction. If you want to let it work on the subcutaneous layer, then you can give it in the depth with phosphatidylcholine, deoxycholine. If it is intermediate, with L-carnitine, aminophylline, yohimbine and artichoke. Okay. So PPC, phosphatidylcholine derived from soy lecithin. PPC penetrates into the adipocytes, breaks down the fat. Okay. Beauty about PPC is only when it interacts with the subcutaneous fat, only then the mechanism of action is going to come into play. Okay, and is going to give you results. So dissolved fat ultimately is taken by the macrophages into the lymphatic system and then drained out of the body. So not only just the PPC has to be given, but a proper diet, proper exercise and weight loss is compulsory to see effective results. So to enhance the lipolytic effect of the PPC, deoxycholate is given. It's a bile salt. L-carnitine can help in both lipolysis and fatty acid oxidation. Artichoke, it's a very good lipolytic agent. Hyaluronidase, okay, which is used to dissolve the hyaluronic acid. It enhances the effect of the PPC. So you want to enhance the effect of PPC, give it along with your PPC and your hyaluronic acid, and you will see a much better results. Okay, Apart from that, aminophylline, caffeine and xanthine, these also can increase the efficacy of the phosphatidylcholine. Circulatory enhancers, now how they work, I'll tell you that yohimbine and aminophylline. Now these are circulatory enhancers. These will ultimately help in clearing the dead adipocytes and increasing the effect of PPC. And similarly, artichoke again is a diuretic and stimulates lymphatic drainage. So let me break it down easy, make it much more interesting and easy for you. Okay, so what I see in medical aesthetics and what error I see in not only in the general physicians but also expert dermatologists and other experts is the lack of usage of enhancing agents, and there is a reason also. It's not wrong on their part as well, because the patients are not ready to pay. And they're not paying. The paying capacity is very I mean, it's not that great where you can actually go all out in terms of enhancing the results. So if you actually see, if this makes sense to you, let me break it down in an easier way for you. Now PPC or deoxycholate, which are your lipolytic agents, they are breaking down the fat. They are doing lipolysis. But from the lipolysis, they are not getting eliminated. To get those dead dead cells eliminated from the body, there has to be increased number of the macrophages and the cells which will take care of those dead cells. Okay, so for that, what is required? Circulatory enhancers. So which will actually increase the enhance these macrophages and mast cells and ultimately help in taking away these dead cells. Okay, now dead cells are being collected and taken away, but if those lymphatic channels are blocked, then the additional carriage or passage of these dead cells would eventually be stopped and the results would be plateaued. So then that is a time when you need drainage enhancers. Now when you are giving drainage enhancers and circulatory enhancers, your macrophages will increase. Your macrophages will have increase, so those dead cells can be taken away, and then you will also have drainage enhancers which will clear out your lymphatic system. So this is something which is never being thought of. All we can think of, okay, if I give the PPC in the subcutaneous tissue, okay, the subcutaneous tissue will be breaking down. But what after that? Why are we not thinking about the macrophages? Why are we not thinking about the lymphatic drainages? If these two aspects are also cleared, the results will be enhanced any day. Okay, so that is why your yohimbine, your aminophylline, your pentoxifylline and your and artichoke are something which you also keep in mind to enhance the results of PPC. And when you are doing mesotherapy, now why this is important? This is important particularly for a reason, because you are not going in the injectable therapy. Your core will be mesotherapy, so you will require these additional enhancement to enhance the results. Okay, so what are we looking at? Phosphatidylcholine, L-carnitine, procaine, okay, along with caffeine, yohimbine, procaine. So you can see circulatory enhancers, lymphatic drainage enhancers in combination when you're doing the mesotherapy. So when you're doing mesotherapy for weight loss, not only lipid dissolving but also circulatory enhancers and your drainage enhancers have to come in play. So they can be complementary, and your primary will be phosphatidylcholine. So in the abdomen, where all we can do meso and your injectable electroporation, your abdomen, your flanks, your thighs, your saddlebags, and ultimately, you know, there is a lot of lymphatic drainage which happens around that area. In the back, upper back, such patients, you can give very good results in combination with phosphatidylcholine, deoxycholate, your hyaluronidase. Along with that, yohimbine as a circulatory enhancer, artichoke as a lymphatic drainage, and you can enhance the results in the weight loss. Okay, so just target that and you can do injectable and meso combination to give excellent results. Okay, so in mesotherapy, cellulite is what you will get best results in. So cellulite is something which is weakened and damaged fatty tissue, which forms those dimples in the epidermal layer of the skin. Okay, so this is how the cellulite will be looking. Okay, it's usually in the thighs, in the hands, in the abdomen. So that is how the cellulite looks. So for cellulite treatment, mesotherapy is really excellent. Okay, it's really very good and effective. So even when you pinch the skin, so that is a time where you can also see a lot of cellulite presence. So this is something which you can give excellent results on, maybe on the face, on the abdomen, on the hands, on the thighs, buttocks. Okay, buttocks is the region where people actually don't want that cellulite to be showing. Okay, so here doing them in the mesotherapy will give you very good results. So as per the mesotherapy, now what we have been working on, we have been working on the fat via the lipolytic effect and working on circulation, which is missed by most of the doctors and all the specialists. Okay, very rarely we see people working on the circulation, but if you work on the circulation, the work on the fat will be too good. Okay, so even when you're doing weight loss therapies, when you're doing cool sculpting, when you're doing U-lipo, when you're doing RF, or when you're doing EMS, EMT, what you are missing on, or what you are missing working on, is your on the circulation, that is venotonic effect, increasing the circulatory enhancement. Okay, to increase those macrophages and increase all of that, to increase the circulation and increase the lymphatic drainage, clear the lymphatic drainage. So then you will have such amazing results in weight loss. Okay, so lipolytic is what your, if you're looking at mesotherapy, L-carnitine, caffeine can be good lipolytics. What are venostatic, that is increasing the circulatory enhancement, routine, aminophylline, pentoxyphylline, and drainage enhancement, artichoke. Okay, so similarly here what we can see, L-carnitine, aminophylline, pentophylline, yohimbine circulatory enhancers, your D.M.A.E, which we discussed in the skin, has come back again in the weight loss mesoprocaine. Okay, so all these can be used for cellulite reduction in mesotherapy. Okay, so as you can see, this was the cellulite on the buttock, and then the cellulite has significantly reduced after doing mesotherapy with these solutions. Okay, so when the cellulite is increased, basically the collagen elastin, they become weak, and eventually they cause the stretch marks. So that is how the cellulite also can be reduced by the mesotherapy. So again, what all other ingredients we can use to increase the collagen and elastin, your silicum, centella asiatica, vegetal proteins. What are the firming agents? So firming agents without the use of Botox and hyaluronic acid, DMAE, vitamin C, DME, idibenol. Okay, so DME and vitamin C are very good. Okay, so this is what we have discussed. So stretch marks, again stretch marks also we are specifically working on building the dermal layer, so where you need more collagen, elastin, hyaluronic acid, connective tissue. So here DMEA is going to be very important. Apart from DMEA, your silicum, your centella asiatica. Centella asiatica is something which helps in forming the collagen. Okay, so centella asiatica, DMEA and silicum will help in the stretch marks. Apart from this, your derma rolling, derma pen, your peels, glycolic acid, this will help in the stretch marks. So mesotherapy, you can actually do it with 4 mm, 6 mm needles, and depending on the site, if you want to go more deep, you will have 12 mm needles as well. So 30 to 32 gauge is what you are going to use, because this will be completely painless. So remember that. Okay, so you have all of these meso guns which are available, so you can select the needle depth and the length, and then ultimately deliver the ingredients which we are talking about. So apart from that, what are the contraindications? Your pregnancy, someone is on the blood thinners, but contraindications are going to be very minimum, as ultimately in the mesotherapy there is just working on the dermal layer, so the complications are going to be very, very minimum. Okay, so let's look at what is the difference. Do you feel there is a difference between mesoporation and electroporation? Do you feel that there is a difference between electroporation and mesoporation? Let me know in the chat. Do you feel there is a difference? Yes, there is one answer, yes. What do others feel? No. Someone is saying no. Okay, so they are working on the same effect. Now mesotherapy, you can deliver it via needles. Okay, mesotherapy can be delivered via needles, so they are different. Okay, they are different. Okay, mesotherapy and electroporation are completely different topics altogether. They are different procedures altogether. Mesotherapy can be delivered via needles in the mesoderm or the dermal layer. Okay, and electroporation will also act on the dermal layer, but via electric current. Okay, via the passage of electric current, there will be ions exchanged and then ultimately the solution reaching the dermal layer. So mesotherapy can be done with the needles which are penetrating till the dermal layer, but electroporation will be just done with machines which will via the ion exchange help to penetrate till the dermal layer. Okay, so now my question is, which one do you feel will have much more depth, electroporation or mesoporation? E or M in the chat, which you feel will have better penetration? Meso, yes, perfect, everyone has got that right. So mesoporation, you will be having more precision, you will be having more control, you will be having more depth control. You know which area to target, which depth to target, and where to go. So mesotherapy will always be preferred in medical aesthetics. Okay, where you're actually going to deliver it via different needles. So I want you to answer this beautiful question now. Okay, and this question will define the fate of medical aesthetics for general practitioners. Okay, and it's going to be a very important question. Okay, so now we are talking about mesoderm and we were talking about mesotherapy, which is working on the dermal layer. So if you are using insulin syringe, are you doing mesotherapy? Yes or no? If you are using insulin syringe, are you doing mesotherapy? With the insulin syringe, which layer are you going in? Okay, so there is a lot of different variation, I would say, in the chat, but I love the activity. It's very great, it's very impressive to see everyone so active. So with the insulin syringe, if you are giving in the dermal layer, does it become mesotherapy? Now answer, now made it more simpler. If you are giving it at 45 degrees angulation. Yes, excellent. So everyone who's joined this currently is actually doing a type of mesotherapy on the scalp, is doing mesotherapy in the skin, and is going to do mesotherapy eventually in the area as well. The cellulite and rest of the things are present. So you're just using the insulin syringe as a tool to deliver these ingredients in different parts of the integumentary system, specifically the dermal layer. So all you have been doing in the clinics, or all you will do in the clinics, is do mesotherapy. Okay, so if you know the right ingredients, if you know the right mechanism of action and the actives and how they are working on the specific site, you will know the results and the outcomes, and the results will be so significantly better once you know what is acting. Like for example, in weight loss, how we know the PPC is working on the subcute, but to complete that action we also need to enhance the circulation plus also enhance the lymphatic drainage. So when you complete that circle, because already you are doing a mesotherapy where you're reducing, limiting yourself, you're not doing invasive procedures, so you need to think in a complete circle where you're also thinking about the principal agent, but you're also thinking about the complementary agents and working, making them work together. Okay, so mesotherapy is something which you will be doing all around, always in medical aesthetics, and electroporation is using a device which will help to penetrate without the needles till the dermal layer, but it will have lots of inhibitions where the depth of this would not be in the deep dermis but epidermal dermal junction or maximum mid dermis. Okay, so as you can see, it does say that the mesotherapy and electroporation has the same level of depth, but mesotherapy you will be having much more precision control, you will have more depth control, and electroporation also will be working on the same, but here there will be the epidermal layer will be intact, and just via the ion exchange you are going to penetrate the same ingredients which we discussed in the mid dermis. Okay, so applications are same in mesotherapy. So what is the ultimate conclusion? Someone is still asking the same question, is it same? So mesotherapy is done with the needles, mesotherapy device is also there, but mesotherapy can also be performed with the needle. So all procedures you have been doing is ultimately mesotherapy only. Okay, so in mesotherapy without the needles also you can do, with the needles also you can do. If it is working on the dermal layer, mesoderm, it is mesotherapy. If you're doing electroporation, you're using the electric current to have an ion exchange to reach till the dermal layer. That is the difference. Okay, so EMS, that is microcurrent. Okay, that is using microcurrent for penetration becomes your electroporation. Okay, so that is the major difference. So you will have devices of electroporation which will work to penetrate the nutrition. Okay, so now we are coming to, that is what brings us to the very new device, that is EPN. EPN is electroporation needling. Okay, so guess what now? It's a combination of electroporation and mesoporation and needling all together. So ingredients will remain the same. The ingredients which we discussed in the scalp, which the ingredients which we discussed in the skin, the ingredients which we discussed in the weight loss, all remain the same. Only the device changes, where the device will have the combination of electroporation and needles together. So what does that make? Electroporation needling. So it will also do electroporation, that will help to penetrate the ingredients in the dermal level, and at the same time do needling to enhance the penetration and give the benefits of needling as well. So mesotherapy, electroporation and needling combined together would be electroporation needling. Till now what we've always heard is MNRF, that is microneedling with radio frequency. This was combined, but what if we combine electroporation, that is penetration of ingredients in the deep dermis, with needling? Okay, this was something which was missing, but now it is available, where it's just a device like derma pen. It's not more complicated, it's just a device like a derma pen where you can control the electroporation power. You can see two numbers, 2 and 3. One is for the electroporation power and one is for the needle depth and the needle speed. Okay, here you can control the needle depth and here you can control the needle speed. So just like derma pen, but it will have the capacity of electroporation. Okay, so as you can see, you can operate that depth and the speed, and then you can do it on the face via rolling method, because again these are needles only. You can do it via circular motion, or you can do a stamping method to penetrate it much more deeper. Okay, so as the area changes, you can change the depth. On the forehead, the depth will be less. On the cheek regions, nasolabials, the depth will be more. Okay, so accordingly the area will change. So electroporation needling along with all the ingredients which we discussed earlier. Okay, so as you can see, the micro needling remains the same, but what is different is these needles are connected to electrodes. Okay, because the needles are connected to the electrodes, what happens is these needles, when penetrated into the dermal layer, they make micropores, and from those micropores the serum or whatever you are using is penetrated to a much deeper layer. Okay, so I'll show you how the electrodes are connected. So this is how the needles are. These are the 9 needles, and each of them are connected to an electrode in the pen. So that will help in penetration of the product at a much deeper layer. So positive, negative, they are placed in that way, and that is how the ion exchange happen. Okay, so micro needling is the common constant, that is needling remains constant, and at the same time the needles are connected to electrodes, which will help in the deeper penetration. So do it on the scalp to get good results with all the ingredients which we discussed. Then it is telogen effluvium or androgenetic alopecia, you can choose accordingly. Similarly, again much better results, and plus you don't even need to do injectables, that is you don't need to go single injectable. You can have the same results with microneedling electroporation combined together. Okay, where androgenetic alopecia, you can still give great results with the ingredients which we just discussed. Alopecia areata, same, you can infuse. Here you can, in the alopecia areata, you can also use 5 mg of Canacort and infuse it via microneedling electroporation and get results, or maybe you can also use PRP and the other ingredients which we used in the scalp for regeneration. Okay, frontal hair loss, again same, you can use those electroporation needle, penetrate those ingredients and get great results. So mesotherapy, since you're going to do mesotherapy, is 365 days, there is no turning back. I mean, mesoderm is the area where everything is, your hair follicle, your subcutaneous tissue, your sebaceous gland. Most of the time 24/7 365 days you're going to work on the mesoderm, so might as well have something which works on the dermal layer in a much more effective way without needling. Okay, acne, pigmentation, similar, again we saw the pigmentation ingredients and the regeneration ingredients. Okay, so that is how that works. And MNRF is microneedling with radio frequency, which boosts what? Collagen, elastin, fibrinogen. Microneedling with electroporation helps to penetrate the product more to the deep dermis, and the product with their science will work on those areas. Now coming to the last and the most important topic for the day. You all are very amazing. Till now you all have been answering very perfectly, precisely, and I'm very impressed the way you all have been answering. It shows your dedication to learn and understand things in medical aesthetics, and that is what the whole idea is, to elevate medical aesthetics to a different level and height altogether. Okay, so that is what is talking in depth, and that is why talking in depth will always take time, and talking in depth and understanding things in depth will always take time. Superficial knowledge you can gain from anywhere else. Superficial knowledge you can gain by just watching or reading a YouTube video or just reading a Google article. Okay, but these discussions, these lectures or these do take some time, and you having so much of dedication is always better. So now you are showing some dedication, and that has a purpose too. Okay, the purpose of course is to give benefits to the patient, but what about the benefit to the doctor? Even we have to be benefited, and that benefit is of course, you can say, you would eventually feel better when the patient is better. but you will feel more better if you ultimately earn much better. I mean, if you are earning more from the patients, if you end up earning much more from the patients, you will be feeling much more better. Your serotonin levels will be high, you will be more happy, you will end up having much more happy lifestyle, and you will live more, you will see more in life, you will learn more, and maybe keep on upgrading and updating yourself. So whatever we saw right now was in mesotherapy, but now what we are looking at is IV therapy, intravenous therapy, where direct scalp vein is inserted in the median cubital vein, and to that scalp vein an IV is connected, and IV is connected, and IV infusions are done. And IV infusions are just not the basic IV infusions, they are little premium IV infusions. And as I told you about the US study, these IV infusions, I'll not take names, but I'll tell you clinics who are charging for one IV infusion 25,000, 50,000. For the package of yearly IV infusions, they are charging 3 lakh, 5 lakh. Few IV centers are there who are just doing IV therapies, nothing else, just IV therapies. As you can see in the center, how the female is sitting on the chair in the bathrobe, and there's a IV stand attached to it. There are recliner chairs, there is a television screen in front of them, and actually they are being charged 50,000, 3 lakh, 5 lakh as a package, okay, and they are actually earning it. Celebrity clients are wanting it. The upper class of the people are actually wanting this, and this in combination with all the machines, lasers, equipments will deliver much better results in terms of everything. So you are giving results also to the patient, you are making money also at the same time. Mental satisfaction, emotional satisfaction, soul satisfaction, monetary satisfaction. So all satisfactions are getting converged when you are also utilizing these aspects, because these are demand of the time. These are required, these are things which people are asking for, and people want this, and this demand is going to keep on increasing and rising and rising. Okay, so all you need to know is about each ingredient and each use case in this IV therapy. Okay, and in this there is a concise PDF slide which talks about all the IV therapies, and we are going to look at it right now. So these are all the IV therapies which you are looking at. Let me zoom in one by one. So let's look at the first one, which is Regiglow drip. Okay, so now this can be anything. This can be, let me give you few marketing insights also. Okay, this drip name is Regiglow drip. So this can be named as Barbie drip, this can be named as wherever you're, depending on the area, Jawan drip, this can be named as glow drip, luminous glow drip, brightening drip, whatever your name is. Let's take someone's name. Dr. Priya is there attending with us. Priya's beauty glow drip. So all these will be the marketing concept for your drip, where you will actually, the indication for this drip would be glowing skin and enhanced complexion. Let's look at the components now. The components are fluids, vitamin C, glutathione, N-acetylcysteine, folic acid, amino acid B complex, Mayer's cocktail, which is nothing but your MVI, and zinc. All this added to a 250 ml or 500 ml of NS, normal saline solution. Okay, and this will ultimately give you beautiful radiant skin, even complexion. Along with that, as we saw, the active ingredient helps in promote collagen development and immune system. Regenerative drip, as now we know in meso solution, DMAE is something we can use in anti-aging. Hyaluronic acid is something which we can use. Glycolic acid is something we can use in the meso. In the IV, we can use fluids, vitamin C, glutathione, collagen, and B complex. Regeneration in the skin, reduction in the wrinkles, and improves elasticity. Revitalized drip. So all, as you can see, the names are different, but when you go to the key ingredients, the key ingredients are almost the same, where it is more banking on the multivitamins, vitamin B, electrolytes. Zinc is always there, so that means trace elements are present almost everywhere. Glutathione is present almost everywhere. Okay, and what does it do? Replenish vital nutrients and elevates fatigue and headache. Regrowth drip for hair, for scalp. Okay, we've been looking at glutathione drip, but someone like Mohammad Shami has, as we saw, who doesn't want to do hair transplant or injectable at your center, but you can always recommend he can undergo an IV drip for the hair fall. Let's look at what is there in that. Glutathione, B complex, MVI, magnesium, sulfate, zinc, that is trace elements, and folic acid. Okay, so all of these ingredients you can see more or less are the same, okay, for hair health and hair growth. So along with this, you will also do the mesotherapy. So it becomes a relaxing therapy where you're not actually pricking the needles. Maybe you're just doing electroporation on that area, or with the mesotherapy device, you're just infusing the elements locally also. Weight loss drip, reduced drip. Let's look at what is there in that. Vitamin C, glutathione, N-acetylcysteine, folic acid, amino acid, B complex, L-carnitine, okay, which is a lipolysis agent which we saw in the meso also, chromium. So along with this, you do mesotherapy, you get much better results in the cellulite. Recharge drip, again this is a very common one for the gym goers, so nothing different. Glutathione, electrolytes, B complex, energy enhancers, amino acids, L-carnitine. So energy enhancers will be all of your amino acids, BCAAs, branchin amino acids, proline, and rest of the things. Revive drip, that is immunity booster. Again, immunity booster will include again electrolytes, vitamin C, zinc, lysine, B12, magnesium, trace elements. So all the ingredients which we discussed in the mesotherapy, they are almost equivalent, but just given intravenously. Renew drip, stress. We had begun the lecture with this topic altogether about stress, about how people's interaction physically has drastically reduced over time, and people are more stressed about things in their life. So let's look at what is it. Electrolytes, B complex, anti-inflammatory, magnesium, and glutathione. So as you can see, the ingredients almost are working in tandem in this industry, and they are giving benefits in different areas. And the recover drip, as I told you, again a very interesting one, that is hangover, used for hangover. So what is it? Fluids, glutathione, anti-nausea element is going to be important in the hangover drip. Okay, so because most of the people who are drunk, next day they feel nauseous. So in the hangover drip, that is post drinking. And by the way, this is actually a requirement for most of the tier 1 cities, for the workaholic generation who are working 9 to 5, and post 9 to 5 they have this drinking session, and next day they have to work. So they would drink morning, maybe they would take the drip and they would go to the work. So that is glutathione, anti-nausea, folic acid, B complex, vitamin B12. So nothing very different. Okay, so what it does in the hangover drip is basically speeds up the alcohol metabolism. The alcohol metabolism is progressed and it relieves from the hangover. So you see the different elements in the drips which are being promoted extensively, and the charges also are very extensive, and you can make lots and lots of money. But my recommendation personally would be you combine mesotherapy and then you combine your drips, and the results will be very good. If you combine, what I am doing in my clinic is also doing mesotherapy, doing chemical peels on the specific areas, suppose it's scalp or it's face, and doing the drip. altogether. So someone who's doing just the glutathione, I'm just not doing promoting the glutathione, I say that let's do the chemical peel treatment also and mesotherapy also along, and that will enhance the result beautifully. Okay, so that brings us to the end of this webinar today, and let's take the doubt solving session. Let's open for the question and answers. Is Redensil, Capexil, Procapil have good results in minoxidil? Minoxidil is the FDA approved therapy. No other better vasodilator than minoxidil. No other better anagen phase enhancer than minoxidil. So minoxidil is always going to be the primary line of therapy. All other ingredients are going to be secondary or complementary. Lecture was so interesting, kept us awake. Yes, you all were also very active, so that was very good. From where we can buy these drips? Buy the ingredients. Okay, let me give you a secret. Now you know the ingredients. Buy the ingredients separately. Make the drips on your own. If you go to buy these ready-mades, you'll end up spending a lot more than intended. How much time should we take to deliver the IV drips? If depends on the concentration. Now if you're diluting it in 250 mg and if you're adding 2 to 3 ingredients over the period of 15 to 20-25 minutes is going to be more than enough. If you added more ingredients, then you can go a little more slower. 30 to 45 minutes is going to be sufficient. IV कितने सेशन दे सकते हैं? Really depends on the indication, what the patient requires. So if the patient is wanting some specific effect, you have to analyze how many sessions is going to take, and accordingly you have to give. In vitiligo, which meso ingredients to use? Copper peptide, tetrapeptide, decapeptide. Okay, these along with elements which increase the absorption of UVA, UVB. So that is there in photo first. So you can actually use them as mesotherapy in vitiligo and do the cases of vitiligo. In vitiligo, there are many other complementary therapies also where melanin transfer therapy and rest of the things are there. So you have to also read about that. Which brand of glutathione IV is the best with good results? Patient to patient, person to person, everything keeps on varying. So you need to analyze what is the patient's requirement. Then you have to decide the dose. So Opitec glutathione even in the IV is preferred. So dosage 2400 to 3000 is the max dosage which you can give. That is also something someone who's really expecting results. I mean in the terms of skin light. Please give dosage of the ingredients. Now for example, skin lightening, let's take a skin lightening. Let's take for example a female who's come for skin lightening. Average 30 years old female come for skin lightening. Glutathione maybe 1200 mg to 2400 mg. Vitamin C 500 mg. N-acetylcysteine to be combined along with that. Your B12, your entire vials of B12, that will be 2 ml of B12. Trace elements will be 1 ml. So all of this in 500 ml of NS and give it as IV. Topical finasteride can use longer. Definitely topical finasteride FDA approved. Something that is FDA approved is long term. Minoxidil FDA approved, finasteride FDA approved. FDA approved hai, so you can be completely sure about very less side effects. So topical again finasteride very good. Will be conducted in few days because I'm new. You will whoever is the MAC doctor will receive the recording, so you can watch it again. Which drip is more effective, ready-made or NS all injection? Ready-made you will get it at a expensive, and ready-made currently you won't know what is there in there. When you prepare your own drips, okay, see, it is all marketing. The game is all about marketing, and what the doctors lack is marketing. Okay, this is my clear-cut analysis. They are very poor. Almost all the doctors are poor in marketing, And the ones who are doing extremely well, they have a team of dedicated marketing people for their clinics who are actually working on the marketing. So when you are working on the marketing, you actually need to have a good name for the IV, a good name to promote the IV, in which ways you will promote the IV. Now there is no stoppage on using of IV in any pathy or any physician. Any physician, you are giving normal saline along with dextrose and rest of the thing for general practice also. Here you are just combining it with what? Glutathione, multivitamin, trace elements. So does it make wrong? No, not at all. So you have to see and market it right and create with your own ability, and that is why you attended today. So you know what to use in the IV for what purpose. Combine it with mesotherapy and you will get more results. Okay, I'm switching on your mics now, so you can also use the mic to ask your question, and in the meanwhile you can also ask the questions in the chat. Can we inject B12 via BD syringe directly into the scalp, or we have to reconstitute it with lignocaine? If you are using mesotherapy, if you are using electroporation, B12 is your readily injectable readily injectable material which can get absorbed easily in the intramuscular area. So you can inject B12 via mesotherapy or electroporation. That is perfectly fine. IV ट्रीटमेंट स्किन लाइटनिंग के लिए बेस्ट कॉम्बिनेशन कौन से हो सकते हैं? वी जस्ट डिस्कस ग्लूटाथियोन, एस्कॉर्बिक एसिड, N-acetyl cysteine, trace elements, B12, zinc, all of these. If we prepare our own, what are ingredients and quantity? The ingredients are the same which I discussed. All the ingredients are available separately. Mayor's cocktail available separately. Your glutathione available separately, ascorbic separately, vitamin C available separately, trace elements available separately, methylcobalamin available separately. All these ingredients are available separately. How to formulate hair meso, or what should be the formulation? Hair meso, you need to see what is the cause. Is it hormonal, or is it nutritional, or is it any other factor? Accordingly you have to formulate the meso. So whether you want to use the multivitamins or you want to use the minoxidil finasteride, or you want to use anything like caffeine and rest of the ingredients, that you have to see what is the underlying factor causing the hair fall, hair loss, and you have to use it accordingly. Zinc dosage is going to be very less because it's a intravenous, so all the trace elements are intravenous. They are meant to be used intravenously. So the absorption in the mesoderm or dermal layer is going to be less. So for example, zinc will be taken in a very less quantity. So say you have 1 ml of trace elements, 1 ml of vial of trace elements. So if you have to take it in the insulin syringe to use it as a mesotherapy, you will use maximum 5 units of the insulin syringe of the trace elements. So that's what 0.1, 0.2 ml of trace elements. Sir, you told about circulatory enhancers and drainage enhancers. We have to give both at the same time, or is it to be given via meso or IV? It's not to be given together. Suppose you have done PPC, you have done phosphatidylcholine, so you can give the circulatory enhancers orally, or maybe in the next 10-15 days you call the patient and do mesotherapy of the circulatory and your lymphatic drainage. Okay, any other questions? Your mics are also on, so that also you can utilize to ask. PPC and DOC can cause necrosis. The beauty of the PPC is it will only and only go and act with the lipids. So there is a technique of giving PPC that it is given subcutaneously 1 centimeter apart the injectable sites, and per site it will be around 0.2 to 3 ml maximum. So first that will be the case, and then if the area of the fat is little larger, then you will deliver a little more dosage, that is maybe 0.4 to 5 ml. They are all ingredients, are there interaction with each other, so you have to see which ingredients you have to use when, and then you have to decide. Is LED mask application effective? LED mask is low level laser light therapy. It helps in penetration, but mesotherapy, electroporation, these are the preferred ways of penetrating anything. What to use for stretch marks? We have cracked stretch marks. Okay, I am telling you, we have cracked stretch marks. 9 out of 10 patients of the stretch marks I was able to give results. So if I was able to give results, you all also should be able to give results. Microneedling, TCA, PRP, GFC. You need in stretch marks, that is triad distance. The medical terminology for stretch marks is triad distance, that is breakage, that is disruption of the dermal layer. Okay, so in striate distance, what you need to do is again formation of the connective tissue. So in how do you do the formation of the connective tissue? By giving wound in that site. So how will you give wound at that site? Microneedling. How will you give wound at that site? Trichloroacetic acid. Okay, creating wounds at the little more deeper layer. How will you give collagen elastin at that site? PRP, GFC. How will you enhance the production of collagen elastin in that site? PDO threads, polydeoxyxanone threads, they lie in the stretch marks for 3 months, and they'll also give that structural balance in that area, and also help in collagen elastin neovasculature. So stretch marks, triad distance is something which is cracked. After all of this, to enhance the collagen, elastin, fibrinogen, hyaluronic acid, do RF in the area of the stretch marks. Superb results. What is the dose of IV carnitine? 500 mg, which is available in injectable vial form. How to reduce blood infections like ESR, CRP through IV? Before starting the IV, I would highly recommend you start doing mesotherapy, because mesotherapy will eventually give you good results wherever the patient is having that issue, and then eventually you start with the IV therapy. Any general or age contraindication for IV? Geriatric patients will have slower results, younger patients will have faster results. So geriatric patients, you will end up having a more number of sessions, so you will end up having more amount of sessions to give to geriatric patients, and younger patients will have faster results. EPN device, which company you prefer? So either you can do microneedling and have an electroporation device separately, or this device which you saw, that is also very good. The cost is little higher, but you can still keep it, because all you want to do in medical aesthetics is work on the mesoderm. So it's nothing better than something which works on the mesoderm with electroporation and needling. So EPN, currently there is only one device, which is this PDF which we saw. IV for arthritis can be done? Yes, it can be done. Definitely it can be done. Sir, please explain the dosage of meso, B12, ascorbic acid, MVI, etc. to inject via insulin syringe for androgenetic alopecia in males. So androgenetic alopecia in males, you will also prefer to use finasteride, dutasteride, that will be prime. Other DHT blocking elements like saw palmetto, pumpkin seed extracts, because you need the DHT blocking element, 5-alpha reductase inhibitor. Okay, now B12 will be since B12 is absorbed easily in the intramuscular layer, so you can take more of B12. that is maybe 20-25 units of B12. Ascorbic acid is again IV and IM, so that you can take around 10 units. MVI is IV only, so you will take less of MVI because the absorption of MVI is going to take more longer time, so maybe 5 to 10 units. 5 units will be okay, and then 5 units of trace elements, and rest maybe you can take NS or lignocaine. I have a female patient with a history of SLA. Can I advise for glutadrip? Glutadrip is pure basic antioxidants. Gluta is always helping for all the conditions. I have given enormous examples of glutathione being used in lung disorders, kidney disorders. I've given, so I'll tell you my experience. Patient with severe creatine level, almost a level where 7 or 8, where the patient was said that you need to undergo dialysis and there is no other options, but at the same time she was doing glutathione IV with us for skin lightening. Somehow the glutathione started working on lowering her creatine levels as she was not taking any other medications. So what we observed, that whenever she did a blood report, blood investigation with doing glutathione 10-15 days prior, her creatine levels always used to drop below the significant level. So kidney function improvement, and it has a role in liver and kidney improvement. Lung disorders, it has worked. Cancers, it has worked. So glutathione has multiple sites role. So glutathione definitely you can give in such cases. Patient with vitamin D deficiency, can we use 2 units to dissolve and inject on the scalp? So it's preferred that you give vitamin D oral therapy because the absorption, see, wherever the absorption of materials are going to take time or the absorptions are going to be very, very slow, try to avoid giving it in the dermal layer because it will take very long for absorption. It will be painful, maybe burning effect to the patient. So where you feel the absorption of the elements is going to be slow or low, keep the dosage very minimal, or rather try to give it in some other way. EPN device, yes. What are vitamin D shots? Happy shots, where we give vitamin D as injectable. Vitamin D shots are consumables also. Vitamin D shots are again given in the IV also. Okay, any other questions? Okay, we take few last questions before we
Sir, in case of skin PRP, when we are giving the PRP to the skin, we are applying topical anesthesia, but sometimes the patients are very sensitive. They are not allowing for the PRP. So what is the way out for this scenario?
Mesotherapy, electroporation will always work, and in my previous lectures also I had explained the role of how the anesthetic or intralesional anesthetic, when you're doing PRP, suppose in the face or in the scalp, and you're giving intralesional anesthetic to desensitize the area, but in the process what is happening is the primary phase of wound healing is delayed. The action of the growth factors at the site is delayed. So first of all, try to avoid anesthetic at all cost. You can use micro needlings which have a higher speed so patients don't get more pain. Okay, so there are examples of Dermapen 4 which have superior speed to and fro motion of the needling. If superior to and fro motion speeds are used, the pain becomes very, very less. Okay, so you can maybe use on those techniques. If the patient is sensitive, you can use cooling to desensitize the area. So cool the area, use a T-shaped vibrator on the opposite side, inject, and that will be better. In medical aesthetics, So as I told you, you have to be confident about your skills, you have to be confident about your therapies, what you're doing, what you need to do is something which you need to know, and then do the therapies. That's why having right skill, right knowledge is going to be very important. Microneedling
Sir,
36 needle. Yeah,
sir,
I'll come to your question. Microneedling 36 needles, 12 needle cartridges are there. So if you want to use on scar and face, which needle cartridge to use and which different needles? So very simple answer, that is the less the needles, the more the depth. The more the needles, the less the depth. So if 12 needles are there, you will have a much more deeper penetration or deeper area of action. The more needles are there, you will have a superficial area of action. So depending on what you are working on, so if the keloid is much more deeper, you need less number of needles. If the keloid is very superficial, you need more number of needles. Yes, go ahead with the question.
sir, in your that PRP class, you told that it is always better to use that local anesthetic in spite of giving blocks.
Correct.
बट
So
सर ये सर अभी पेशेंट था मेरा पीआरपी किया मैंने तो सर उसको मैंने बोल दिया था 45 मिनट्स पहले क्रीम अप्लाई करनी है तो सर पहली चीज़ तो ये कि इट वाज ऑल ग्रीसी आफ्टर क्रीम सर उसको कैसे मैनेज करना है सर और दूसरा सर पेशेंट वाज फीलिंग पेन
okay. So first of all, what anesthetic you used?
सर दैट प्राइलॉक्स
2%.
यस सर
Okay. So there is a spray called as lox spray, 10%. Bupivacaine and lignocaine combination 7%. So first apply the cream 7%, that becomes almost 14%. 10% of lox spray on that area and cover the area wherever you're doing. So you have to cover that area, so the effect, so you don't have to wait for 45 minutes, you can maybe wait for 20-25 minutes and you will get the result. So 10% of lox spray, that is lignocaine 10%, and 7% of bupivacaine and lignocaine together combination. So that is, you know where you have landed. In the topical, you are in the highest concentration. Cover that area for more efficacy. Once that is done, in 20-25 minutes you can start the procedure. Now for the greasiness, so the spirit swab, gauze, with this you can clearly clean the area, you can completely remove the greasiness. If you wash that area clearly with the alcohol spirit swab, you will clearly see remove the greasiness, and then it will be much effective. So you increase the number and concentration of the anesthetic which you are using. It has to desensitize, that is the science behind using topicals.
Okay, sir. Sir, please do share this in message also so that I can arrange the brands.
Definitely.
Thank you very much, sir. Thank you.
Will you please see WhatsApp image for stretch marks, which needle preferred for microneedling? So you need to go deeper in the stretch marks, so you need lesser needles. So maybe 12 needles is going to be perfect, ideal. So wherever you need to go deeper, less needles. Wherever you need to go superficial, more needles. Dosage of Kenacort for keloid alopecia areata. Dosage of Kenacort is safest dosage is, I'll say, around 5 mg in the intralesional keloid, and even in the alopecia where you give multiple, not in one side. 5 mg, still you can dilute it in NS or your lignocaine. So maybe you're taking 5 mg in 20 units and 20 units of NS or lignocaine, and then inject in multiple sites, not on one area. Acne scar ingredients. So where you need to improve collagen, elastin. So DMAE, your collagen, elastin directly, PRP, GFC, all of these can be used. Okay. Any other questions? Okay, I think we are done with the session today. It was really amazing. And just a confusion, so PRP to create inflammation. I did not get the question. Which vitamin D is good for? Architol is very good. The taste is good. It is sugar free. Why do we use MoMET-F? Again, by using steroid, by using MoMET-F, you are going to reduce the phase of wound healing. It is going to slow down the process, but just to make sure that the inflammatory erythema is reduced, that's why you can use MoMET-F. If you feel that the patient is okay, patient can do without mometasone, so just fusidic acid is going to be good.
Sir, what is plasma fibroblast?
Create wound creations. If you create wound with plasma pain, it will create fibroblasts. So that is the main ingredient of your mesoderm, which we saw: fibroblast, collagen, elastin, connective tissues, with all those ingredients which we saw. So creating wounds with the plasma pain will ultimately cause creation of all of that. How many sessions of MNRF? Depends on the type of scar. Whatever acne scar, how many acne scars are there, the type of acne scar, rolling, box, ice pick, accordingly you have to use. Can we use MNRF with meso solutions? You can either use MNRF or you can use MNEP. Okay, so if you are using MNRF, you will be using on the acne scars. So if you are using on the acne scars, you will be using everything to deal with, to increase collagen, elastin, growth factors which will help to increase collagen, elastin in that area. Collagen and elastin brands. So there are collagen serums, elastin serums, collagen, so many serums are there. You can use any of it. What is the mechanism of action of IV in L-carnitine? Helps to, so basically, as we saw, even in mesotherapy, even in the mesoderm, the L-carnitine will help in localized fat reduction in cellulite. So more number of carnitine in the IV, that is intravenous, also it will help in basically reducing the fatty acids in the body, and then ultimately having this inch loss. Can we see melanocyte transfer video? Melanocyte transfer is again a complex procedure where from a site, where from area the skin is taken, and from the skin the melanin are derived, and then they are cultured in a tube, and then that melanin is used in the vitiligo. So it's a complex procedure. It's not that simple. That's what I'm saying. It's a complex procedure, so it's rather best to use mesotherapies in vitiligo and give results. Will there, and plus in vitiligo cases, there are even post melanin transfer, there can be still re-damage and reoccurrence of vitiligo. So it's better that you go for some conventional therapies. Will there be inflammation in the body? Absence of vitamin D in my clinical experience. Reduction in iron, HB level, platelet levels, there can be more inflammation. So rather than vitamin D, it's the iron, HB level, platelet levels which have to be seen. And of course then other deficiencies, if there are body is having complete deficiency, the inflammation tendency is much higher. What will be the interval sessions of L-carnitine? So just not the IV therapy. Here you need to give mesotherapy, injectable PPC, deoxycholine, you have to give diet, you have to give oral supplements, and then also IV. So none of them are just your what you say original, just one therapy. You have to combine it with multi. Currently I have no access to the WhatsApp, so I can just take your questions.
Sir, anti-aging treatment like Pediathreat and Botox, if you are using in a single patient, so which will be the first, the Pediathreat followed by Botox, or Botox followed by Pediathreat?
Pediathreats first and then Botox, because you want the Botox to be lying in one specific plane. You don't want that to shift. So Pediathreats will be first preferred, and then you can do the Botox. Yes, that will be done, Dr. Amit. All right, I think we've reached to the end of the session. You all were amazing. So I want you to use this insight and knowledge in your clinic, and then enhance your practice. Start with the IV therapies, and uh, you know enhance your income also. With IV therapies, I don't think so anyone will have any questions around that. So IV therapies is something which you should definitely start with all those menu. Maybe start a IV bar in your clinic, and have that recliner chair along with some screening of some videos, Netflix or something in front. Okay, so I think that brings us to the end.